Live testing, presenter's laptop. Live testing, clerk's laptop.
One to the, okay, we'll start again. So good morning and welcome to the Board of Health meeting this morning. We're all here, quorum is present, staff are present as well. The members of the public are advised that our meetings are webcast live by the City of Hamilton and temporarily archived on the city's website, as well as a reminder that all other electronic devices are to be switched to a non-audible function during our council meeting. And I will now do a roll call, and I'll start with Councillor Wilson, if you would indicate present.
Okay.
Councillor Wilson. Go to the multiple view here so I can see everybody. Thank you. Councillor Farr.
Good morning, Mr. Mayor.
Good morning. Councillor Nan.
Good morning. Present.
Good morning. Councillor Marula.
Good day, sir.
Thank you. Councillor Collins.
Present.
Thank you. Councillor Jackson.
Here.
There and everywhere. Councillor.
Yeah, here.
See you, Councillor Pauls. I see you. Councillor Danko.
Present.
Thank you. Councillor Clark. Councillor Pearson.
Present.
Councillor Johnson.
Good morning.
Good morning. Councillor Ferguson. Don't see him yet on the call. Councillor Vanderbeek.
I'm present.
Thank you. Councillor Whitehead. Not as yet. And Councillor Partridge.
Good morning.
Good morning. So good morning all. Thank you. Hopefully you're bearing up under the heat. Madam Clerk, speaking of heat, are there any changes to the agenda, please?
Yes, Mr. Mayor. We have added, can you hear me? Oh, sorry.
Yep.
Sorry, we're just watching the doors do something strange. So we have added communications items 5.5A to S, which is correspondence respecting face coverings in enclosed public spaces. The recommendation for this correspondence is that it be received and referred to the consideration of item 10.5 respecting face coverings in enclosed public spaces, BOH 214. We have an additional discussion item 10.4, which is the interim plan to resource and structure public health services during COVID-19. And we have additional discussion item 10.5, face coverings in enclosed public spaces as well.
Great, thank you. Are there any comments on the agenda? If not, I'll take a motion to approve the agenda as amended. Moved by Councillor Partridge, seconded by Councillor Vanderbeek. Anyone want to speak to the agenda content? If not, we'll go to an electronic vote. Thank you. Already there. Wow, Lauren. Wow. That was faster than fast. And Councillor Pauls, you're
yes, I'm on, but it didn't come up. So
didn't
yes.
come up. Thumbs up. Thank you.
Yes.
Anyone else? Wasn't present. Councillor Clark. Give us a thumbs up in any event. Okay, thank you. All good? I'm going under the assumption that that's carried 14-1. Okay, it's popping up on the screen. Yeah. Okay, while you work on that, I will ask if there are any declarations of interest. Anyone have any declarations to identify? I'm seeing shaking of heads, not nodding. Thank you. So could I then have a motion to approve the minutes of June 16th as presented? Moved by Councillor Pearson, seconded by Councillor Jackson. Any other comments? Okay, and we're just going to have to hang on until we get the past vote cleared up and the current vote put up. Can we do a show of hands just to keep it moving? Bear with us, folks. We're just trying to sort out another glitch. Yep. Can we go with the show of hands on the minutes? Okay, you've opened the vote on the minutes. Okay, we can get to it. Anyone not able to vote, please indicate your support or lack thereof. Councillor Pauls, can you vote on this one? Anyone else not able to? Done. Councillor Nan, Councillor Marula, Councillor Clark, yours didn't come through for whatever reason. Anyway, thumbs up on that. Council, thank you. Thank you, Councillor Nan, Councillor Marula as well. All right, they're all in. Thank you. Yep, I'm holding. Okay, thanks. Communications items 5.1 to 5.5A to 5.5S. Some of them have recommendations. So what is your wish on the communications? You can take the communications as presented. We could have a motion on that. Do I have a mover for that? Okay. I saw a motion by Councillor Ferguson, now present, and Councillor Pearson. Anyone want to speak on any of the issues? Not seeing anything. Okay, on the communications then, moved and seconded by Ferguson and Pearson. All in favor, electronic vote. We'll be with you shortly. There it is. Councillor Nan, you're okay, thank you, thumbs up. Anyone else? Councillor Pauls, did you manage to vote? Yep, good, thank you. Okay, perfect, thank you, that's carried as well. And we're gonna turn to discussion items. So first item of business is 10.1, Nurses Family Partnership Program Funding and Service Level Update. Jen Vickers-Manzin is here to speak to the next three reports. So Jen, do you want to take it in terms of your overview of this, please?
Thank you, Mr. Mayor, and good morning. So
Good
the
morning.
first report before you is 10.1. It's a recommendation report to extend the existing agreement with the Hamilton Community Foundation to support the Nurse Family Partnership. So you'll recall that Hamilton Community Foundation has been supporting this program for some time. Further, that Nurse Family Partnership is an evidence-based program that targets young, low-income, first-time mothers and their children, and studies consistently demonstrate favorable impact on child and maternal health, as well as family economic self-sufficiency. So these funds in the amount of $41,000 go to support some of the operating costs of the programs that include our incentives, educational materials, and licensing costs.
Okay, thank you. Any comments or questions on it? Councillor Pearson, do you want to speak to that? Okay,
Nope, moving it.
Okay. Moved by Pearson, seconded by Councillor Partridge, and Councillor Nan, you're on the speakers list, so away you go. Yep, I see you, Judy. We'll get you. Councillor Nan.
Thank you, through the mayor. I forgot that we had to move and second it in order to get the speakers list identified, so thank you for that. Thank you for the report. I was just curious, as this is, I believe, the first time that this is coming forward this term, and if it was last year as well, then my apologies. But I was just curious about why we're relying on outside funding in order to support this program that has been consistently turning out incredible outcomes for residents.
Jennifer?
It seems core to our public health mandate in terms of our health equity and target populations in terms of young mothers. And so
Okay,
if I could,
thank you.
through you.
Jen?
Through you, Mr. Mayor, to the councillor, it's a good question. So I'll just remind the Board of Health that a report did come forward in 2019 as well.
Okay.
The program is funded by the Ministry of Health and mostly, and that funds 7 public health nurses. I'll also remind the Board of Health that Nurse Family Partnership was originally not funded through the Ontario Public Health programs, but has since come under our Healthy Babies, Healthy Children home visiting program as a targeted program specific to our high-risk youth. And so, as you all know, our funding over the years has been very tight in public health. And the support from Hamilton Community Foundation has allowed us to maintain our FTE support while also having the necessary incentives that are very important to the program.
Okay, thank you. Councillor Ned?
Thank you. And then through the mayor to staff, you had mentioned that it is integrated into our Healthy Babies and Healthy Moms program. So is this program specific? I noticed that there's a copyright symbol to it as well. Does that have any play in why this program isn't funded through the province in its entirety?
So just maybe I'll start, sorry, through the mayor to you, Councillor. I'll start with a little bit of a history of the program. So in 2007, Hamilton was the first Canadian city to pilot NFP, the Nurse Family Partnership Program, and it's an international program that's been implemented across the globe with a significant amount of research studies and evidence behind it, and it's based out of Colorado by Dr. Olds. After our feasibility pilot that ended in 2011, we had Board of Health approval to continue with the program. At that time, that program was something that was locally adapted in Hamilton based on our needs and supported both by a Board of Health locally as well as the ministry. It is not a program that's mandated under the Ontario Public Health Standards like Healthy Babies, Healthy Children program is. Since that time, there's been significant amount of communication between ourselves, other health units in Ontario and British Columbia, which is now another province that implements this program across the province. And the province of Ontario is quite aware of Nurse Family Partnership and has agreed to fund the positions in Hamilton, as well as there's other health units that are now implementing a Nurse Family Partnership program in the province as well.
Thank
Thank
you.
you.
That's it. Thank you.
Great, thank you. Councillor Partridge and then Councillor Wilson. Councillor Partridge.
I believe Councillor Wilson may want to speak to this. I was just going to raise the conflict of interest. I just want to make sure everybody's covered off, but she's on next, so I'll defer to her.
Okay, thank you. Councillor Wilson, you're up. We can't quite hear you yet. Sorry? Yeah, try your center button on the microphone or replug it into your laptop pad again. Still not happening, unfortunately.
Now?
Yes, you're on. Thank you.
Thank you, Mr. Mayor, for letting me know.
What was the fix on that one, so I know in the future?
Well, just like the TV or the computer, you just unplug it and put it back in again.
Wiggle wires. Yeah, okay. Thank you.
Everything in life. Thank you.
Yeah.
Yeah, I would like an opportunity to speak to this. As Jen has pointed out, this began quite a long time ago in Elmira, New York. A gentleman who was working in I believe, a daycare center in a lower income neighborhood. And it has now populated and taken off across certainly North America. It speaks to exactly what we should be doing from a public agency perspective, in that it is evidence-based, it is targeted, it is collaborative, and for every dollar we get, we're saving a tremendous amount of money. So it is key, and I think it's a wonderful example, and it's proof that it works. And I believe, Jen can correct me, on our population health, at least from a code red perspective. I think one of the few, unfortunately, avenues that we gained improvement on was that of low birth weight babies. And I trust and hope that we can do much more of this kind of preventative policy action on all fronts going forward.
Okay, thank you. Did you Want to hear from Jennifer
Yes, please.
Vickers-Manson?
Yes,
Yep.
thank you.
Jennifer, please.
Through you, Mr. Mayor, to Councillor Wilson. Yes, you are correct, Councillor Wilson. It does continue to make an impact on the birth weight of our moms that are involved in the program.
Thank you.
Okay, thank you. Back to Councillor Partridge.
Yes, thank you, Mr. Mayor. I'm just curious because on 10.1, unless I've missed it, I believe there's funding from the Community Foundation. Is that correct?
That's correct.
Yes, so I'm just wondering if Councillor Wilson would like to declare a conflict.
I think the councillor is aware of that, and it'll be her choice to decide whether she should or shouldn't.
Okay,
So
I
thanks
just
for
want to make
pointing.
sure everybody's
Fair enough.
covered. That's all.
Good to
Thank
point it
you.
out, and I'm sure that the councillor's thought on that and has made a decision as to where she's going to go. Unless there's a change, we'll marshal on. All right, so it was moved by Ferguson, seconded by Pearson, as I recall it. A vote on the recommendation, which is to continue that partnership, is coming up. And there it is. Anyone unable to vote? Okay, all in. Great, thank you. Thank you very much. Next item is 10.2, which is the AOL Youth Center secondment. Again, Jennifer Vickers-Manzon's here to speak to that. Jennifer, did you want to do an update or an overview or a quick introduction? And
Sure, thanks, Mr. Mayor. So
thank you.
before you is a recommendation report. It is about our long-standing relationship with Banyan Community Services. We've had a public health nurse seconded to AOL, our AOL home in Hamilton since 1990 for some time. And since that time, our public health nurses there have been doing health promotion activities as well as activities in primary care. In 2019, we brought a report forward to reduce the FTE slightly based on some financial pressures experienced by Banyan. And we eliminated the health promotion piece and really focused more on the primary care piece. This year, on February 14th, we got written notice to terminate our secondment as of April 16th in 2020 in response to budget considerations. And Banyan Community Services plans to recruit and retain nursing staff to fulfill the primary care roles in both of their facilities. We are committed to maintaining our relationship with AOL Youth Home in an ongoing way. So, any questions?
Okay, thank you. Are there any questions? If not, we'll take a motion to approve the report. Moved by Pearson, seconded by Councillor Pauls. Any comments or questions? Seeing none? Okay, thank you. Let's support that. Jennifer, thank you very much. Important support programs in our community, indeed. Anyone unable to vote? Looks like you're all very able. All in, thank you very much. And the next report is the COVID-19 response and health equity update. Again, Jennifer Vickers-Manson here. Do you want to do an update or overview?
Sorry, sure, Mr. Mayor.
No problem.
So the report before you really just gives a high-level overview of some of the activities that have been involved in planning our response to COVID-19 in our community. It really focuses on the collaborative efforts between Public Health Emergency Control Group and the City Emergency Operations Center. It talks about the health equity lens that's been utilized through public health programming, and that we specifically consider this in our emergency response planning and how we applied specific frameworks to help ensure that we were identifying the challenges faced by vulnerable populations and that we work together to ensure that actions have been taken to protect and support vulnerable populations throughout the pandemic. So the report outlines some of the documents that we referenced in our planning, as well as some of the operational implementation of that.
Great, thank you. A motion to get the information report on the floor. Moved by Nan, seconded by Farr. Any comments or questions on the report itself? Councillor Nan, go ahead.
Thank you. Through the mayor, thank you for the report. And I have a few questions. So at any point, if I'm going over my time, please let me know, Mr. Mayor, and I will cede the floor and move on to the second round of questions. So I had a few questions, and I appreciate that this is a high-level report, and I have a lot of keen interest in figuring out some of the details. So if you could, through you, Mr. Mayor, there was a comment in the report about looking at congregate living settings as well as our vulnerable homeless or vulnerable population that is experiencing homelessness. And there has been a few studies and a few cases across Canada in other municipalities where there has been an effort to keep those who are experiencing homelessness in place. And that when we enable or very specifically restrict encampment specifically to specific locations, then public health units and community partners are more enabled to provide the supports that that population needs. Specifically speaking to the fact that this population tends to be shelter averse, and recognizing that there is all this incredible work that Hamilton has been doing in terms of surge capacity building around our shelter system. But I was wondering through you to our staff, if I could get public health staff to comment on that review, or if that review has taken place, and what is emerging as a learning or best practice in terms of encampments and supporting them localized in the areas where they
Thank
set
you.
up.
Jennifer?
Through you, Mr. Mayor. Can you hear me okay?
Yes, we can.
Great.
And we
The
see you.
council. To the councillor, thank you for your question, Councillor Nan. Michelle Baird is our Chief of Operations. She's very close to the operations and some of the work that's been happening in our encampments in terms of what's going on. So I'm just going to turn it to her to answer the question.
Thank you.
Thank you very much. Michelle?
Thanks. Through you, Mr. Mayor. With respect to encampments, Councillor Nan, I don't have information with respect to what we're doing from a COVID operations perspective. I will say to you that with shelters and our homeless population, you will know that we did try to, the city made additional shelter space available to help mitigate the issues with respect to COVID. And as well, we've been doing COVID testing within the shelter system. The encampment issue, on the other hand, has very much been managed by housing and homelessness, and we haven't been beyond that homeless population doing specific COVID work in encampments.
I appreciate the answer, and I'm happy to go offline and dig a little deeper, because I would appreciate a public health lens on the benefits of encampment-based wraparound supports versus the incredible work, I'll say it again, the incredible work the City of Hamilton has been doing around surge capacity building and to meet the needs of a growing or anticipated growing population who are experiencing houselessness, specifically given the bill that the province is currently fast tracking in terms of actions for residents as well. So anticipating a population surge, right? And none of us have a crystal ball. None of us can predict this is going to be a reality, but the possibility is there that we're going to experience an increased population that is homeless. And understanding that there are conflicting and compounding reasons why some residents are shelter averse. What else we could be doing from a health perspective in terms of the outcomes that were listed from a health equity lens perspective, and what public health's role could be in helping shape that strategy and that work. So I'm happy to take that question offline and work a little bit more deeply with our public health staff on that one. Moving along to migrant farm workers. We had a great report last Board of Health meeting, and I'm really excited to hear about the partnership in terms of testing, and also the partnership in terms of reviewing the housing conditions that migrant farm workers are experiencing on some of the farms here in the vicinity of our city. I was just curious from a public health perspective, what happens after a test is done? How does a migrant farm worker receive care given the limitations of their status?
So through you, Mr. Mayor, I'll answer that question as well, Councillor Nan. So as an update to you, the testing on the farms has not yet started. We had hoped WA start it this week. We're still waiting for research ethics approval. As you know, that testing that we're doing here in Hamilton is part of a research study as opposed to part of our core business. However, to answer your question with respect to what happens afterwards, it's a very important question, and one that there's certainly been a lot of learning across the province, particularly in the areas that have been most impacted by outbreaks among migrant farmers. And we have had some discussion locally with some of our partner physicians who work in the community right now with homelessness, the homeless population, but with the desire to put a care plan in place and how do we wrap care around these migrant farmers should there be a case. The other piece to add to that is there's guidance coming, and they're looking at this at a provincial level, and we expect to see some plans
Yes,
to
and
address
I have
exactly
also
that
heard through
issue.
the mayor that there's conversations now also happening on a federal level, given that it is a federally regulated program as well. So I look forward to hearing more about the potential for the care plan that our city can be supporting. The next question I have, page 5 to in the chart about public health approach to managing prisoners. And I was wondering through you, Mr. Mayor, to staff, if there is any on staff who can talk to council or this Board of Health about the fact that there is currently, my understanding is from community input, that there is currently a hunger strike happening at the Barton jail. And in part, the hunger strike is speaking to the conditions in the jail in a COVID context. So part of it is speaking to malnutrition or accusations or alleged allegations of inadequate access to food, as well as allegations around improper conditions to support the health of prisoners at the Barton jail. So is there anybody who could speak
Okay,
to
and
that,
I'm not
please?
sure who you're going to flip that to, Dr. Richardson or otherwise.
Or if that's something that can be followed up on.
Yeah,
Thanks, Mr.
I think they
Mayor.
are broader issues, but go ahead, Elizabeth.
Thanks, Mr. Mayor, through you to Councillor Nan. So when it comes to other areas that are under another level of government's jurisdiction, we generally work with that jurisdiction. So it's not something that we would be primarily involved in. They would involve us if there were specific issues that were public health related that they needed our assistance with. And so we have worked with them, for example, on testing to ensure prompt testing and those sorts of issues related to COVID. I think we can follow up with the jail further, as we're going to talk about soon, just as we're going through these issues. And there's no doubt these are all important issues as we're thinking about them and whatnot. But I just need to be very clear from a resource perspective, we are extraordinarily stretched. And so, I think this is part of what we need to talk about in terms of priorities and whatnot going forward. We completely understand the health equity issues and agree with you, about how important they are. That we speak to that often. I think as we go forward, that's part of what we're going to need to consider.
Okay, thank you.
Yeah, and I truly appreciate that because, when we're talking about vulnerable populations and health equity outcomes, when we do this work well, we also recognize that it requires adequate resourcing in order to do the work well. And in order to see the kinds of outcomes that we're aiming for, specifically looking at our vulnerable population, then I feel it's imperative to at least shine the light that we acknowledge that these issues are here, but also then have a very thorough conversation about how we're going to resource the outcomes that we're aiming to accomplish, especially since health equity is a guiding framework for the work that public health does. I'll hold the rest of my questions for there
I was
and
just going to tell you
move it
you're
along.
beyond
Thank
your
you.
5 minutes, so you can jump back on. I have Councillors Clark and Vanderbeek as well to speak. Councillor Clark, floor is yours.
Thank you, sir. Good morning. So I just had a couple of questions about the migrant workers. I'm trying to understand, does the city of Hamilton or public health have any authority to go in and inspect the migrant housing, the bunk houses as they call them? We're hearing a lot of concerns being raised, but I'm not sure who exactly is doing the work to inspect. And I'm trying to understand what our municipal role is. And I'm not looking for more work for our staff because we are short on resources, but I'd like to know who's doing the work.
Dr. Richardson or Michelle, if you're okay.
Through
I
you,
see it.
Mr. Mayor. To the counselor, yes, so public health does have a role and a mandate with respect to inspecting those temporary residences that the temporary farm workers live in. That's part of our routine work. We do that each season as the farmers arrive in Hamilton. This year for COVID, certainly we've stepped that up. So we're not only looking at our usual practices, but we're looking to see that the bunk houses and the living settings are set up in a way to minimize the possible transmission of COVID within that farm setting as well. There are some pieces that are done in advance to ensure that the farmers are having the temporary farm workers who arrive isolate on site. So we do routine. We're basically in the farms right now on basically a daily basis to different farms in Hamilton. And we continue to check up with respect to what the conditions look like, as well as whether those isolations are being maintained. And then,
Thank you.
of course, surveillance for illness and things like that.
Councilor
Thank you.
Parker.
And thank you, Mr. Mayor. And I would have a supplemental to that. I think I heard, and I might have misheard it, Michelle, in response to, I think it was Councillor Nan or Councillor Wilson, that we're not testing the migrant workers yet because we're beginning a research project for testing them. And I'm
Correct.
trying to verify the timing as to when we're going to begin testing them. And why wouldn't we be testing them now, regardless of what the research project is going to do? It's important that we understand what's happening now.
Through you, Mr. Mayor, I'll answer that one as well to the counselor. So basically, there's been some issues with respect to testing. There's lots of politics and concern right now around the whole issue with migrant farmers. There's some resistance among the farmers themselves, as well as the temporary farmers, and concern with respect to their employment and what COVID testing means. The reason we were doing it from a research perspective originally is because the study is set up in such a way that we are working with the farmers as well as the migrant farmers up front to help understand why the testing is important, what the fallout will be, to basically gain support and try to increase uptake of the testing. The testing itself is one that's a self-screen that's done by the farmers. So we have staff that'll be there, but they're doing a nose throat swab on their own. So hoping that that is realizes more receptivity and allows us to engage directly with the farmers and have those discussions. The other piece is the testing that's happening on farms right now outside of that. So elsewhere in the province is being led by OMAFRA with Ontario Health. And we're just not in a place to start that testing yet. We haven't had any illness reported on our farms. And to date, the inspections, I mean, there's corrective actions that happen, of course, but for the most part, we don't have the issues that we're seeing elsewhere in the province. So our testing is very much a proactive approach to try to both get the support of the farmers, get the testing underway, but also develop that relationship to allow the follow-up to occur.
Dr. Richardson, I see your screen lit up. Did you want to add something?
It was really, thank you, Mr. Mayor. Just through you to Councillor Clark, was to emphasize that piece about that Michelle had raised at the end, which was about the role of asymptomatic testing where there aren't really issues going on. So we have been, as a province, really looking at what is that role, trying to understand it, long-term care, retirement homes, childcare, and now this temporary farm worker housing situation. And absolutely, if there's situations of concern at all, and that is why our program is keeping close tabs with these farms to understand
what is going on there, make sure there aren't any concerns whatsoever. That if we had concerns, we would go in and look at testing from an outbreak management perspective, but from the standpoint of doing sort of asymptomatic screening testing, we are trying to understand as a province, and OMAFRA is really leading in terms of understanding how that all comes together.
Thank you. Councillor Clark.
Thank you, Mr. Mayor, and I thank Ms. Baird and Dr. Richardson for their answer. It does handle my concerns, so I appreciate that. Thank you.
All right, thank you. I've got Councillors Vanderbeek, Wilson, and then Marula. Councillor Vanderbeek.
Thank you, Mr. Mayor. I'd like to ask a question, and if this is not the time for me to ask it, just let me know and I'll save it and put it wherever you tell me to put it. The questions, yeah, we won't go there.
That's an offer I haven't heard for a long time. Thank you.
Yeah,
Thank you for that. Yeah.
well, a little levity on a Friday. What I would like to ask is about the length of time that the test results are taking to come back. So if this is not the appropriate time, can you tell me when I could ask that question?
I don't see why that can't be answered now. So I know Dr. Richardson has been addressing this, and it's been in the paper. So Dr. Richardson, a quick answer on the potential delays, predominantly in the labs, not on the testing side or swabbing side, but in the lab side. Dr. Richardson.
So when it comes to the testing delays, this has been a challenge that's gone on throughout this response, trying to make sure everything's ramped up and ready to go, and most all of that system really plays out once the test is done, which is done by other parts of the health system. It's done by our some of our primary care docs and our hospitals at their urgent care centers and our assessment centers, and then it goes to the lab, and the lab network has been trying to manage all of that. And our understanding is that the turnaround time in terms of getting the test done is pretty quick. It's getting done most of the time within about 48 hours. The challenge that we seem to be experiencing now is trying to get the data uploaded and able to be reported out to people so people can look it up on that portal. Seems to be more of a challenge here in Hamilton and a couple of areas around the province than perhaps elsewhere. And so we have been connecting with Ontario Health, who works with the labs on that part of the chain of information in order to get it out. And unfortunately, there are still delays. So we know our assessment center colleagues, they are working very hard to figure out other things that could be done to try and get results more quickly. Everybody's trying to address it. I would say as the systems become more complex and the number of tests larger, that it's become more and more challenging to figure out exactly where the breakdowns are happening that prevents that from happening. So we're working with them, and we do still see on our positive test results that we are getting those about 60% of the time within 24 hours. So that is really good news in terms of disease control. But from the standpoint of frustration for others, many people are still getting them quickly through the portal in a few days. But unfortunately, it is taking longer, and we appreciate the very much how very frustrating that is for people, especially those who want to see their loved ones or are quite concerned about whether the illness they have is COVID-19.
Thank you. Councillor Vanderbeek.
Thank you, Mr. Mayor. So through you to Dr. Richardson, I think, I've had several inquiries about this. Most of them around the need to have testing every 14 days in order to be able to see your loved one in a long-term care facility. So in order to see them, you can only see them once a week. You have to have had a test within the last 14 days that comes back negative. And if you're waiting 10 days to get your test results, then it's very problematic. And so I guess what I'm putting out there is that I know you know this, but I just want to put it out there that it's a big problem for people who have loved ones that they haven't seen for months, for the first 3 months anyway, of the COVID crisis, and now have an opportunity to see them if the weather is permittable once a week, and if they've got a negative test within the last 14 days and they're waiting 10 days for their test. Can you help with that?
Absolutely, Councillor. You expressed it very well, and we all have tremendous empathy for the difficult situation this puts them in. I know for those who, there are people for whom they may have difficulty printing a test or that sort of thing. And so we are trying to assist in with those individuals in order to get them printed. We know that the assessment centers are looking at other ways that they could assist, and we do expect some more from them very soon around that piece. But in terms of the actual challenge in the data management side, that is where we're working with Ontario Health, and they're trying to figure out what else they can do to make that happen more quickly.
Thank you. Councillor Van Der Beek.
So thank you, Dr. Richardson. Through you, Mr. Mayor, is there a way for us to reassess the expectation that people will have a test within 14 days to manage to make their once a week appointment or for their loved one? Is there some flexibility in that given the problems we're having at the moment? Or is that just too big of an ask?
Doctor?
Through you, Mr. Mayor, I think this piece around the requirement for testing every 14 days, that is something that's been continued through the provincial directive. My understanding is that's not anticipated to be varied, but I think this is something absolutely council could correspond with the province on about the need for this, especially when there are challenges in getting test results back.
Thank you, Dr. Richardson. I appreciate your answers. Thank you, Mr. Mayor.
Thank you. I see no harm actually in communicating that frustration to the province by way of letter or other highlighting the issue. I think it's come up a number of times, and I think the Minister of Health should be made aware that this is an ongoing frustration. Wonderful that you open up the door to let people visit, but very difficult to do if this testing regime is unusually delayed, and that it's a frustration that started right from the very beginning. So I'll come back to you if you want to kind of fashion a letter to send to the Minister of Health and the Premier to make them aware and encourage them to find a resolution to this.
Okay. Thank you.
Thank you. Councillor Wilson.
Thank you, Mr. Mayor. Through you to Michelle or Dr. Richardson, I'm really interested in the ethical framework and the documents and the principles underlining it, and I appreciate the summary that was provided in the tables. I was wondering if, and you've cited them in the references, but I'm wondering if it would be possible, particularly the human rights one and the Ottawa framework, if they could be provided to us as members of council if we express an interest.
Thank you. Dr. Richardson.
Through you, Mr. Mayor, absolutely. We'd be happy to pass along the Ottawa framework as well as the other guidance that's been provided.
Thank you.
Thank you. So supplementary to that, Dr. Richardson, could you educate me on the transferable nature of that ethical framework that may be specific to these conditions of COVID versus how it could be or should be guiding the approach and the priorities, the outreach of this municipality in general to all matters of public health or all matters within our realm or scope of responsibility. I'm just trying to understand if that's possible or if in fact we have a pre-existing ethical framework that guides our work.
Dr. Richardson.
Through you, Mr. Mayor. So ethical frameworks for public health, there are a number of them that are out there. This one was raised and discussed amongst health units in Ontario, specifically during COVID, but absolutely ethics are a core piece that underscores all of our work that we do, and we pay close attention to ethical issues and ethical frameworks as they're debated and considered in our work. So these would broadly apply to all of our work and are absolutely one of the tools and things we have as we go through. It's kind of like our equity framework. These are some of the principles that we think about as we go through programming. Of course, with equity, we also have specific programming that's targeting specific issues as well.
Thank you, Dr. Richardson. I'm just trying to understand what's specific to this ethical framework that would cause it to be specific, if you will, to COVID, and why maybe there weren't tenets of something else pre-existing this. Does that make sense?
Through you, Mr. Mayor, perhaps I've not been clear. There are many other frameworks that exist that have been used and considered within public health programs and services over the years. This one was a particular one that was discussed at this time amongst the medical officers as one that was useful to apply to our approach as we remind each other in our programming about some issues that we need to be mindful of and think about. I don't think there's anything specific to this framework that it is the only one that could be applied to COVID. There are other frameworks out there that could also be applied, but it is a good framework, and it's one that we're able to use consistent language and talk about together, and that makes it easier for dialogue and discussion and specificity. So that's the one we applied.
Thank you. Councillor Wilson.
Thank you. The report references in a number of spots communication with our vulnerable neighbors. And I know we have a report coming from you near the end of this agenda that will probably, we'll have to revisit the importance of communication with respect to masks. And I was wondering if you could enlighten me on, just give a few examples, for example, of the ways and means in which we're ensuring that our vulnerable neighbors are getting the information that they need, because we are moving, I hope, or we don't practice a criminalization of public health. So how are we doing that?
Through you, perhaps I'll turn back through you, Mr. Mayor. Perhaps I'll turn back to Jen to give you some examples, because she's been working very closely with these things.
Thank you.
Thank you.
Thanks, Elizabeth. Through you, Mr. Mayor, to the councillor. So we've been in constant communications, of course, with our operations in the City Emergency Operations Center. And we have a team of folks that are designed to link in with our vulnerable sector. And of course, we've been working closely with our housing partners and our shelter health partners to deliver services and monitor the impact on these populations in our community. In addition, we've done outreach to our Indigenous partners as well. And we have a health sector table, which is a collaborative table across the health sector to identify common issues and priority populations, and making sure that we are taking a coordinated approach across the city to ensure we're meeting the needs as best as possible of those vulnerable populations. I would say, in addition to that, we also have our hotline where we have the ability to hear from folks on an ongoing basis, and certainly people are reaching out and we're hearing from them directly, as well as our Indigenous partners we've been reaching out to. I'm sure I'm missing some other opportunities, but we have been talking very collaboratively across the sector. Our partners in Good Shepherd, as an example, to really problem solve on an ongoing way.
Thank you. Councillor Wilson, you're beyond the 5 minutes. If you want to jump back onto the queue for questions, or if you have one final one, feel free.
I have two finals, so I'll get back on the queue, Mr. Mayor. Thank you.
Thank you. Councillor Marula. They'll unmute you in a second here. Kind of caught him by surprise. Go ahead.
Thank you, Mr. Mayor. Just a couple of things. And all of the issues that are being brought up are very merited. But what I'm finding is more and more is that a lot of the issues that are being brought up are not within our jurisdiction, but within the jurisdiction of the provincial government and the federal government. I understand that we have more opposition members than government members, and that's why we can't get anything done in the city. But we can't be everything to everyone, and we have to understand that we are at the bottom of the totem pole, and we need to educate the public about who we should be targeting. And we shouldn't be targeting ourselves, because that's a form of downloading, and we know that's a crisis in the city. So through you, Mr. Mayor, to Dr. Richardson, who governs and who's responsible for Corrections Ontario and the migrant worker program in Ontario?
Dr. Richardson.
Through you, Mr. Mayor, corrections is the responsibility of the province. And in terms of migrant farm workers, there is a bit of a joint responsibility around that one from the federal, provincial, and local levels. So the federal government organizes that program, sets out general expectations for it, and MAFRA works with local farms to set out means to improve farming in Ontario. And we know, of course, that these farm workers are absolutely essential to our food supply and to keeping all of that going on these farms. Locally, within public health, we do, as you heard from Michelle earlier, we do have a mandate around inspecting the migrant farm worker housing as part of the Ontario Public Health Standards, and that is a role we play as well. We would play a role in terms of infection control and prevention, disease control, the kinds of roles that we're playing with COVID-19 right now.
Okay, and as a funding source, what allocation of funding directly comes from the province to deal with the migrant worker file?
So our funding for public health has been increasingly moving to a global budget. And so we have the annual annual programs and services budget that provides funding for public health. And we do, as you might recall from our February report, lay out a series of programs and services across all of those standards in terms of the number of FTE and dollars, resources that we're allocating to that. And the province reviews that as part of their function. Specific funding continues for things like the seniors dental program and a very few other things, but it is part of our global budget.
Okay.
Thank you.
So we have to understand that for every request that we make of ourselves, there's a cost and a resource that's expected with that. With 3 levels of government, and I realize all of the focus, 99% of the focus from the media and the keyboard morons on social media is city council. What they fail to realize is that we're a creature of the province, created by the province. We have no constitutional bearing. We have no constitutional authority. People, we should defund a little bit of the education system, because the level of ignorance surrounding who does what and who pays for what in this province, country, and the city is enormous. So let's take a step back, and I think we need to have an in-service about what level of government is responsible for what and who we should be targeting for action from that government, because we're just spinning our wheels constantly. And can somebody please wake up the opposition members in this city, because who are they and where are they and where are they hiding? Because we're paying a significant amount of money to these foolhardy individuals who are absent. They're missing in action. We need some action. Thanks very much.
Okay, thank you. On the update, we have Councillors Johnson and Councillor Clark for a second time. Councillor Johnson.
Thank you, Mr. Mayor. I'm really glad that we're discussing this issue, and thank you, Councillor Vanderbeek, for bringing it forward, because as you all know, I've been anxiously waiting to see my father, and I have to go for COVID.
Might want to pull your mic up a little closer to your. There you go.
Sorry.
Thank you.
Thank you.
No problem.
Again, I want to thank Councillor Vanderbeek for bringing this issue, and I think that it's something that we can highlight. We may not have jurisdiction on it, but every time there's a new restriction that comes down the pipe, we're the ones that end up getting stressed, department-wise, staffing-wise, and resource-wise. So Councillor Vanderbeek brought up a good point. As you all know, I've been anxiously waiting to visit with my father. I'm going for a COVID test this afternoon. While I was making my appointment, the really nice lady on the phone, who also sounds very stressed, was telling us that since this new restriction came down, it created more pressure on the public health, because now so many tests were done a day. Now they've almost quadrupled it because people are trying to see their loved ones. And I agree with Councillor Marula. For everything that we put on ourselves, it drains another bank account, if you will, because of the staffing and the testing. So I'd be happy to second this motion to ask the provincial government and the federal government for either resources to help us get more testing and get it done quickly. I've already been warned that it would be maybe 10 days before I get my results, which means I'll be able to visit my father within a 4-day period, and before I go for another COVID test, to wait for another 10 days to go and see him. So chances are, if I get to see him twice a month, maybe once a month, then I'm going to be pretty happy about that, because that's where our limitations are. So Councillor Vanderbeek, I'd be happy to second your motion. I'd also like to put in there that they also provide the resources to our public health so that we can get more testing done, get it done quicker. And then that way people that are in the nursing homes can visit with their families. And just as a personal note, folks, I have noticed that with my own family member, his confusion is getting worse because he's not with people he's more familiar with. He's sequestered to his room. It's not a nice situation. So getting them in touch with their family members to get them to see them face to face, personally see them face to face, will do worlds of good. So I'm just advocating for that. And Councillor Vanderbeek, I look forward to your motion coming.
Okay, thank you. I've got Councillor Clark, second time.
Thank you. So it's on the same issue, Mr. Mayor, because I've received a number of calls complaining about they want to see their loved ones, but they can't because they haven't got their negative test results, and it's taking longer than the 14 days. So can I just ask for clarification from Dr. Richardson, sir? The city of Hamilton's responsibility in terms of public health would be the actual implementation of the test, doing the swabbing. Is that correct? That's our sole responsibility in this situation?
Doctor?
Through you, Mr. Mayor. Actually, Councillor, that's not correct.
Okay.
Our responsibility in this process, the decision about the frequency of testing has been governments, provincial governments. The testing of individuals is the responsibility of the assessment centers. And in Hamilton, what we did as a health sector is we got together and we each took a role in doing those. So the hospitals are running 2 of the assessment centers. Primary care is taking the lead on the 3rd assessment center, which is run at the Dave Anderchuk arena. Across all of those, staffing is being collaborated with the family health teams and other primary care docs taking a part in them. What we offered to do was to be in an effort to have a single number where people could go to for COVID information. Was we offered to be the booking. One of the ways that people could book and schedule an appointment, and as well, primary care can do that as well. Our actual role and responsibility in the broader picture is in responding to positive test results and doing the case control and contact management related to those positive test results. What we had also done was offer for people who did have negative results and who were not able to print out their tests because of accessibility issues. We know people will have issues with internet. This gets back to the health equity issues, internet, printing, all of those sorts of things, that they could come to us if they gave us permission to access the results through the online portal. The other thing we have been doing, of course, is trying, because we know the significant both pressure this is having and the challenges that it has for people. We have been trying to work with the various partners on Ontario Health to try and facilitate some resolution, identification of the issues and resolution of those issues. But our actual role and responsibility is around responding to positive tests. I'm going to just turn to Jen and Michelle, because all of us have been, and Nin as well, to just make sure if there's anything else they want to add on this subject.
Please, thank
while we're talking about it again.
Thank you.
Tran?
It's Jen, Dr. Richardson.
Okay,
Thank you.
Jen, go ahead.
I don't really have anything to add. I think you covered it well.
Councillor Clark?
Thank you. And that's very enlightening for me and maybe for others. So then the fact that people are not getting their negative tests and the fact that the Premier is outraged and finds it unacceptable, it's all within his purview and his departments to get the information to the people who should have the information in a timely manner. It's their responsibility, not ours, correct?
Through you,
on the negative tests, not the positives.
Through you, Mr. Mayor, just to make the point that early on in this, we were getting negative test results in order to facilitate the communication of those, but that stopped. It's been a tremendous volume for the lab to have to send us both, and everybody's trying to optimize the use of resources. Testing is very important, but it's also been very demanding, a huge expansion of resources. So at one time we were doing that, but as things have changed and the portal became available and all of those things, that it's been through that route that has been happening.
Thank you. Ms. Clark?
And so finally, it appears to me that there's 2 different goals in mind. One, we're trying, or the province is trying to ensure that people can get to their loved ones in the long-term care facilities, and that's why they're doing the testing and reporting the negative testing to them so that they can see their loved ones. But on the public health side, we're doing the follow-up on all of the positive testing for contact tracing to find out who's being exposed. And that's another positive goal. So there's 2 separate goals to it. So I'm fine with the suggestion from the mayor to write to the premier. I found it frustrating to just simply hear that he found it unacceptable, but there doesn't seem to be any fix happening, and the problem continues. And we're all getting the phone calls here, and I know it's a provincial issue, but it's all filtering down. People are calling our offices, and it's frustrating not getting the responses from the provincial government that we would like. So happy to support the suggested letter, Mr. Mayor. I think it's a good idea. Anything to help you and Dr. Richardson get the point across to the province that they need to step up. Thank you, sir.
Thank you. Councillor Vanderbeek, did you have a direction in mind?
I do. I'm just trying to massage it here, but I'll read you what I've got. As the provincial requirements for proof of negative testing within 14 days are required in order to visit loved ones in long-term care facilities within the province of Ontario, and as the turnaround time in Hamilton at this point is taking up to 10 days for negative results. Therefore, be it resolved that the mayor and/or City of Hamilton Medical Officer of Health communicate with the provincial chief officer of health and/or the Minister of Health and Long-Term Care to express these challenges and request that the province provide the resources or make adjustments to meet the demands of the volume in order to comply with their requirements. I think it needs a little wordsmithing.
I think you've captured it, and we'll certainly capture the essence of the discussion in the letter that we'll draft. So, and it should go to the premier, as well as all local MPs and MPPs.
And the premier.
Correct. Okay. Anyone have any difficulty with the essence of that? Seeing none, Councillor Clark, thumbs up. Thank you. So let's vote on that then. So, and again, we'll reflect the discussion in the letter, but I think it's direction to send a letter to highlight the issue to. Sorry. Yeah. Yeah. Fair enough. Fair enough. So we need to move the update. It was moved earlier and seconded earlier, as I recall it. So let's get this vote on, or get this issue accepted. So to receive that report, and then we'll vote on your motion. Coming right up. Thank you. And I see no additional discussion on the motion. So the motion is as presented. It's moved and seconded by Councillor Vanderbeek, seconded by Councillor Johnson. All in favor or opposed? Or abstaining? Yep. Lauren's just adding that vote. Here we go. Anyone not able to vote? Working out great so far. Thank you. Yeah. I'm not jinxing anything. Thanks. I'm being the forever optimist. Thank you. And that's carried. And we're going to go to item 10.4, I should say, the interim plan to resource and structure public health services during COVID-19. Dr. Richardson.
Thank you, Mr. Mayor. And it was quite appropriate that I think it was Councillor Marula raised earlier the annual service plan and budget, the question that led to the discussion of the annual service plan and budget for public health services. And indeed, when Council approved that plan back in February, we did not know what was in store for us for the coming year. And so, as you heard from us earlier in May, we have been looking at what it was that we set out to do and what adjustments can be made as we go forward. And we've been bringing you a series of reports about how we can do so in a world where there is COVID-19. So I'll just go through a few things, just give an overview. One of those things is just the significant amount of resources that have been deployed to this response here in Hamilton. And so we have at present about 240 public health staff deployed to deal with COVID-19. We have about 450 people in total who work with us. We also have about 37 city staff who've been redeployed from other departments to assist in the response. So tremendous effort that has gone in, and we've been very fortunate to have the support of our colleagues, and a very collegial and collaborative environment here in Hamilton has been our experience over many issues and many years here, which has been just great. And we do need to continue to be responsive to COVID-19. As Bart Harvey likes to say, this virus just keeps, being unpredictable and throwing us new issues. And as we've seen, as we've gone through this, we've dealt with the issues related to travel originally, and then we have dealt with the outbreaks in long-term care and retirement home facilities, and just how much of a challenge and those have been as we went through those. And now we've moved into temporary farm workers in other areas. And here in Hamilton, we know our temporary farm workers tend to come later in the year, the larger numbers. And so we will, be looking forward. We're continuing to do work to try and prevent any issues, much as we've done in long-term care and elsewhere. But we are aware that that has yet to come for us. We've seen in other jurisdictions a lot of workplace-based outbreaks, and we haven't had that here in Hamilton, but it's something we watch for and move forward. And as we reopen, we have a lot of work that we're doing with all of these places, workplaces and others, in order to support them in reopening. And that has led to a lot of work as well. And as well, we need to be responsive to provincial direction as they come forward, and that continues to be refined as they consider issues themselves. So we know that COVID-19 is very important, but at the same time, all of the other things that public health has addressed over the years, all the other issues from family health to chronic diseases, to other areas of environmental health, air quality, climate change, all of those things are very important to our health as well. And so it is important that we be able to reopen as much as we can our programs that do that health promotion, disease prevention, our health protection programs that really do make a difference to our community's health, and not just be expending resources on COVID-19. We do know for some programs we won't be as able to get the work done, particularly for 2020, as issues still get worked out at that level. And so we are recommending for those staff that they, in addition to the infectious disease, epidemiology, health equity staff who normally work on infectious disease control and infection control, that those staff be redeployed to continue working on COVID-19. Some areas, though, we are anticipating may have increased demands. And as we look at the school programs and as they get back up and running, and the significant issues around mental health and substance misuse, those kinds of issues, we think there may well be increased demands as we go forward. So it will continue to be a somewhat uncertain time, and we're going to need to continue to be flexible and responsive to all of the factors that determine health in this community and the health issues it faces. As we've begun to reopen, and you know that we've continued to provide a list of essential services throughout this beyond COVID-19, but as we try to get back to reopening, we have rated our programs red, yellow, green in terms of the time-sensitive nature of getting them back and opened. And we've been concentrating right now on just our red programs for about the last month, and it's been quite challenging, both because of working in a COVID-19 world and figuring out all the things we need to do to practice good infection control ourselves in that environment, and make sure that our staff and the people we work with are safe as we reopen, but also because of the demands that keep pulling people back to do things related to COVID-19. So it's been quite challenging to move those forward. We're just getting to the point of getting our red programs restarted, and are then going to look at our yellows. So moving forward, we are asking for up to just over 75 FTE to support the ongoing COVID work specifically. There are amongst those FTEs that we're asking for many specific skill sets that we just don't have enough of. And so there is no hope that we could redeploy people to fulfill those functions. Those are things like public health inspectors, epidemiologists, or public health physicians, where we don't have the skill sets to do that work. As well, you'll note that I use the word up to in terms of the recommendation. And that is because the situation does continue to change. We are very much looking at this on a dynamic basis. Our federal and provincial counterparts are doing what they can to help us in terms of supporting us in case and contact management, looking at new, you may have heard about a new data program that's being considered for public health, which would make a significant difference. And so we've actually adjusted downward the number of people we are thinking we would need in order to move forward. And we'll continue to make those adjustments and hire just the people that we need to on a temporary basis as we move through this response. We are also apropos of the discussion about assessment centers and testing. We know in Hamilton, our assessment centers were initially designed to see about just over 200 people a day. With the opening up of testing that happened, they're seeing well over 400 into the 450 range, and some days have gotten up into the 700 mark. Consistent with us playing a joint role around the table, we are asking for an additional 17 FTE that would be to continue to help with the booking and scheduling function that we have been doing. And we're asking for that to be provincially funded through um, other funding lines than public health. And of course, if they were to decide that we would not be the ones to do that, that would not be work that we would continue to do. We would hand it over to whoever is being funded to do that work. We are also recommending a one-time investment of about $265,000 to implement Kronos in public health services. You know, it's been implemented in other parts of the corporation and been successful there, especially as we continue to have more of a 24/7 operation. We're working weekends, we're working more shifts to cover longer hours. It would be very, very helpful to us in terms of doing the work and reduce the demands, particularly in our finance and administration, amongst our finance and administration colleagues, where we would indeed need more staff if we were not to go forward with that implementation. For all of these staffing and including the one-time costs, we are recommending that the province be asked to fund these resources 100%. The dollar value we're looking at here is about $2 million in addition to the $1.6 million that has already been spent. We do know, in addition to there would be the one-time costs. We do know that the province has said that they have $100 million set aside for public health programming, knowing that there are going to need to be extra resources to support these costs. We've been told by the province just the last day or two, Dave Trevisani, our manager our finance manager has been in contact with the province on a regular basis, and he's been told that they're expecting to have both our funding letters and our requests around what the extra supports are that are needed by the end of July. And so we do expect a timely to this report, at least ability to make that submission, but would still recommend that the mayor correspond directly as well. So, Mr. Mayor?
Okay, thank you. Can I have a motion or a mover and a seconder to get the issue on the floor? Moved by Pearson, seconded by Councillor Pauls. Thank you. And speakers list at this point is Councillors Clark and Councillor Jackson. Councillor Clark. Give us 1 second. Here you go.
There we go. Thank you, Mr. Mayor. Can I start with, I'm trying to understand why they're FTEs. Why wouldn't they be contract positions if we're not expecting them to last any more than 1 to 2 years?
Doctor?
Now I'm having troubles with all my buttons that I've got here. In terms of FTEs is simply the measure that we use, if you will, to say it's the full-time equivalence. So it's 75 full-time equivalents. For example, we could find it's easier to be somewhat flexible, and we would hire in a certain group of people part of those part-time. And so the actual number of people may be higher, but the total number of full-time equivalents would be 75. Absolutely, what we're saying is that we would hire these on a temporary basis as we go forward for the duration of what we need. And we would be reporting back to you regularly about where we are at in this deployment. We are anticipating this will be for the remainder of 2020. But it may well need to continue to go into 2021. And so that's what we wanted to make sure you were aware of as we go forward. We will continuously look at where is that needed, where can we get other resources from that could fulfill those functions. We are aware, though, too, that many of these skill sets that we're talking about are in very high demand across the province. We know other health units do have public health inspector positions, epidemiologists, all the same things that we're talking about out and being hired. And of course, these are not easy skill sets to obtain. They require many, many years of schooling to acquire the skills that we're talking about.
Okay, Councillor Clark.
I appreciate the answer. The recommendation doesn't say temporary though. It says FTEs, which the implication, if we read this 2 years from now, they were full-time jobs of 75 people that will continue on until we make the decision that they no longer continue on. It doesn't say temporary. It doesn't say that this is just specific to this situation in the motion. So I'm just concerned that what we're really doing if we pass this is we're hiring 75 new FTEs and 17 new FTEs, and it's really for this incident and there's no exit plan.
Thank you. Doctor, is there any harm in putting in temporary in item A?
No, Mr. Mayor, there's no harm in putting temporary into that piece. And as I said, we'll be reporting back regularly. And if it was found that we do need to extend beyond 2021, then we would be looking to bring back a report much before that to explain that. Of course, I've no doubt we'll be talking to you about COVID-19 often over the coming months.
Thank you. Councillor Clark.
Thank you. Thank you, Mr. Mayor. Item number D, it talks about 100% of the cost for the COVID response. Can Dr. Richardson remind me what the current funding formula is? It used to be like 75, 25, 75 to the province, 25 to the municipality. What would the normal funding ratio be in this situation?
Doctor.
Through you, Mr. Mayor, our baseline funding has been 70-30. Changed to 70-30 from the 75-25 that we had enjoyed previous to this. In terms of extraordinary issues such as this, in the past, we have received 100% funding. We have, for issues like rabies, as we've talked about over the years, had 100% funding for that. When we were given top-up costs for other urgent issues, we have also received 100% funding over and above the ASPB. So we're absolutely expected to expend all of the existing resources that are allocated to us. But then if there are extraordinary costs above that, it has been 100%. We've not, aside from hearing that there is money available and they will be asking us for it, we've not heard specific to this event what they're planning in terms of the funding ratio.
Thank you.
Thank you. And the last question is with regards to alternatives. Page 7 of 8, it references a number of programs that we would need to pause if we were looking for ways to mitigate the costs. It talks about pest control, talks about school dental and visioning screening, the school program. So do we know what's going to happen with the schools in the fall and how these two programs would continue to operate in a changed world in the schools?
Doctor.
Through you, Mr. Mayor, we do know that that schools are going to have been given 3 different modes that they can operate under. And as you heard from the minister yesterday, their preference is for in-person schooling to resume. And just to comment on that, because I think it's very important that we've been all very concerned about both protecting our children as we go through this and the people who work within the school system, but also very concerned about childhood development and what this issue and what schooling from home has meant for kids. And so, we're all very interested in making sure that whatever school programming we're able to resume in the fall very much supports child development in a very positive way. And we also anticipate that we're going to be dealing with some significant challenges that kids may be facing as they do return to school. I'm going to just turn to Jen Vickers-Manson, though, to as well add any comments about school programming and dental and vision screening as we go forward.
Thank you. Jen.
Thank you, Elizabeth. Yeah, I would say I would support Elizabeth's messaging related to school. We have been in contact with our school board partners throughout the pandemic on several fronts, and most recently, they have been reaching out to us regarding support for mental health for children and youth in school, as they're flagging that as an issue. In terms of what the programming will look like, once school opens up, I think that's dependent on several factors. And so we are planning in advance to see what we would be able to do relative to what the school plans would be.
Okay, Councillor Clark, you're beyond the 5 minutes if you want to get back on.
If you can come back to me, I just have comments and then I'd be finished, sir. And it'd be very fast. Thank you.
Well, do you want to do them now if they're going to be very
No,
fast?
no, I don't want to break the rules.
Okay.
No, no.
All right. Fair
no,
enough.
come back
Thank
to me.
you.
Thank you.
Councillor Jackson, Ferguson, Danko, and then Partridge. Councillor Jackson.
Thanks, Mayor Eisenberger. Dr. Richardson, thank you for this report. I'm going to piggyback a little bit on Councillor Clark's concerns and questions. So let me help me understand, Mr. Mayor. We've talked about globally from General Manager Zagaric about a potential $60 million to $120 million deficit hit because of COVID. Are these requested 92 FTEs and the dollar amount equivalent part and parcel of that deficit we've been talking about, Mr. Mayor? Through you to Dr. Richardson, please.
Through you, Mr. Mayor, I might ask Paul to address that question. I know there's been discussions between our finance manager, Dave Terrazani, and Mike trying to get down the precise numbers, but I'm not sure, Paul, exactly where things landed there.
So through you, Mr. Mayor, I'm not sure we have those precise numbers. I think I'd have to take this offline and come back to you, Councillor, with some of that detail.
To all of Board of Health, that would be appreciated, General Manager Johnson. Thank you, because for the taxpayers in this community, I think that would be important to know. Secondly, Dr. Richardson, I'm going to throw this out there. It'll be similar to the next item later on that we're going to be dealing with as well. You and our EOC team have done such a phenomenal job curtailing and containing COVID-19 in our community. Last numbers, approximately 840 positives, 44 deaths, every life valuable and important and sad to lose, but 44 deaths in a city of 550,000. And we're requesting here up to 92 FTEs because you're the medical doctor, I'm not. COVID is going to continue. Many have said until a vaccine is found. There are going to be parts of our community, taxpayers, that are also worried financially about the future and about property taxes and taxes at all levels of government in light of, unfortunately, what the pandemic's done. So I'm trying to rationalize what the great job you and the EOC have done in Hamilton. There's going to be a segment of our community that's going to request, really, Dr. Richardson, you need 92 more FTEs simply because COVID isn't going away? Through you, Mr. Mayor, please, to Dr. Richardson, maybe as much as possible to give more of a layman's type of answer to my question,
Thank
please.
you, Doctor.
Absolutely. Through you, Mr. Mayor, and I just want to emphasize that the distinction between the 75 for the public health response and the 17 for the testing to support the testing that is going on in our community as we go forward. So when it comes to dealing with COVID-19, it's absolutely raised a whole level of new concern when it comes to infectious diseases and what it is in terms of the response that's specific to this. You know, we've been trying very hard to limit the spread of this disease because of the impacts it can have. We are a world that has not had COVID-19, so the number of people who are susceptible is just about all of us at this point. Is still, you know, we see in seroprevalence surveys that, you know, maybe 5%, maybe slightly more have become immune to it, and we're still not sure what immunity to it means. We've also seen in parts of the world where they haven't taken the very tight measures, particularly around case and contact management, which is what public health does, contact tracing, which is what public health does, infection prevention and control, which we've seen throughout this has stood us in very good stead to reduce the impacts of outbreaks, to reduce the impacts in terms of diseases and in terms of deaths. All of those things have been absolutely critical as we go forward. And we've seen in areas where they haven't done that, where they haven't been able to do that, like Italy, like Spain, that the impacts can just be tremendous in other ways. And so we are asking to, you know, we are being asked by the province, we're being asked in order to not have those kinds of impacts, to continue to do the work, to continue to do the case management, can do the contact tracing, to continue to do the infection prevention and control. And in order to do that, we need resources to do it. There are many, many things that affect people's health. We've just been talking about child development in schools and some of the many things that public health does otherwise. And those things continue to be very important and have long-term impacts that may exceed those of COVID-19, probably do. So we need to get back to doing that work as well. And so that's why we're asking for those extra resources on a temporary basis. We're giving you the upset limit of what we think that we will need. We will absolutely try to keep those. We know the financial stressors that this has placed. We know that government has set aside funds provincial government has set aside funds. And so we are looking indeed to those levels of funding. But of course, in the current policy environment and at the direction of the province.
Okay, Dr. Richardson, thank you. And I do admire you for proactively saying, hey, there's a whack of money, 100 million that the Ford government has put aside specifically for this. So I admire you and thank you for saying, hey, Hamilton should get its share of it. And I suppose, Mr. Mayor, we'll see down the road if we don't get all of what Dr. Richardson is hoping for, or any of it, then obviously that's going to be a 2021 budget pressure. Lastly, Mr. Mayor, I would support Councillor Clark's amendment to ensure the word temporary is included. Thanks, Mr. Mayor.
Thank you. And that temporary would be in both A and B. To Councillor Clark on that. Councillor
Thanks,
Ferguson.
Mr. Mayor and Elizabeth. I'm reading through the report, and the people who pay for this are taxpayers. I'm going to ask the question, why do you need an additional 92 staff now when we really seem to be reaching the bottom? At your last report in June, this didn't come up, but you said at the start in April you were getting 12 per day in new cases, and now we're probably 1 to 3 per day. And so my question to you is, how do we explain this to the public that now that we're over the hill, if you will, the curve has been flattened, with what the objective was since this whole process started? Why now do you need 92 more staff rather than back in April when this thing peaked out?
Through you, Mr. Mayor, just want to note that we did bring forward in the last report as well the fact that we were anticipating we would need ongoing temporary resources to deal with this. At that time, our estimate was actually higher, both in people and in resources. And my colleagues have been working very hard to figure out a way to do this as economically as possible while making best use of the skill sets we have and the resources that are being offered to us from other levels of government. And so in terms of response, you know that we've had at peak almost 270 public health staff and another 40 some city staff who have been redeployed to this effort. And absolutely, when we're in an emergency situation, as we have been, the city as a whole has applied all of the resources it could and needed to in order to bring this disease under control, make sure that our citizens stay as healthy and safe as they can, work with all of the partners, nonprofit, business, whatnot within this city to continue to provide services and be safe here in Hamilton. And as we look at what this is going to mean in the longer term, yes, we've gotten to the point of flattening to the curve, but this is going to be, we need to continue to live in this world with COVID-19 for the foreseeable future. We don't have other means right now, like a vaccine, like treatment to prevent the spread of COVID-19. So while we've done a very good job, and I use the analogy often that we're like a team in training or an athlete in training, and we're all trained now on those public health measures, and we need to keep doing them. We also need to keep supporting those measures, and part of those things are the case and contact management, the infection prevention and control, working with business. And as I've said, in terms of us even trying to get some of those other very time sensitive public health programs and services up and running, it's very difficult to do. We don't have the staff, we don't have the resources that we need to do to continue to respond to COVID-19 and get our public health services reopened. And so as my management team, my colleagues have continue to do this work to figure out not only how to respond, but also where do we go from here and what do we need in order to be effective and efficient in the ways that we work. These are the estimates they have come up with. You have our continued commitment to be as efficient as we can and to only go as far as we need to as we go forward.
Councillor Ferguson.
Okay, I don't think I heard an answer to my question. From a common sense perspective, and you did do an amazing job so far, your whole team, and through that April swell, if you will, and then since then it's been steadily declining, and it looks like there's some good news out there with only, I think there was 1 or 2 today, nothing yesterday of new cases. So you have less cases to track now than you did back in April, but you didn't have 92 staff back then. Is the workload not starting to ease up because you're not getting the new cases that we were back in that period?
So through you, Mr. Mayor, thanks again. And I will try to be clear. Not only did we have 92 people reallocated to it, we had 270 people reallocated to it, plus an additional 40 some staff. And so what I'm saying is those over 300 staff do need to go back to their work and do the work that they were doing. And we're going from having over 300 people deployed, and we're saying to go forward, we need 90 forward. As well, what we do know is that while the cases have flattened, and you're right, the number of cases is down, we still do continue to have cases. We still continue to have contacts that need to be managed, and that's not going to go away. We're not going to eliminate this virus. It's going to continue to happen. We continue to manage suspect outbreaks that occur. There is a lot of work just on that front. As well, on the infection prevention control with reopening, it has burgeoned as we go forward. And so while we did think that perhaps that work would start to reduce, it's actually been more than ever. And as schools go forward, as each thing goes forward, and so as I was saying earlier, we have seen in other regions the things to come. We anticipate we will also have more things workers.
Okay, and
And
I think
so
I
we
think
do
I
need
heard
these
you say that
resources
one
to
of the main
continue to do that response.
reasons you need the staff is other people have to go back to their old jobs. And so of the 92, how many are people that are going to be leaving public health and going back to their old jobs? Go ahead.
Through you, Mr. Mayor, what we've done is we've redeployed with resources that we have, and so all of those people would, part of those people would go back to their jobs, all except our core. I don't have exactly for you our number of infectious disease control, epidemiology, and health strategy and health equity staff who would remain working on this. I can tell you that that's the difference in terms of what we need going forward. And 75 again of those would be for public health services, and 17 for Ontario Health West for Ontario to work with Ontario Health around assessment centers.
Because I'm just sitting from the outside looking in. I'm puzzled why people are going back to work. How they're going back to their old jobs. Our rec centers remain closed. Our city halls closed. All our facilities in the suburbs, the Ancaster Community Center, the Ancaster facility here is closed. And where are these people going back to? I suspect we still have a lot of staff at home being paid that are not necessarily working at their original jobs. Can they not be redeployed into public health to help you with this contact tracing and administrative duties that they do in their regular work?
Dr. Richardson?
Through you, Mr. Mayor. So absolutely, Paul has discussed with his SLT colleagues, and I'll turn this over to him to answer further. But we do know that they are looking at that. They will continue, just as we are within public health services, to look at what could be redeployed within the city on a temporary basis to assist where that's possible. To date, we don't have anything further than that, but that is what we will continue to do and look at as we move forward to try and bring those numbers down. So I'll turn it over to Paul.
And through the mayor, just to add to that, some of what Elizabeth is putting forward here is to the end of 2020. So there certainly are opportunities for continued redeployment in the next number of weeks, but not through the entire fall. So as our pools have reopened, some of those redeployed staff come back to recreation. By the fall, we will certainly be looking at reopening all our community centers. As you've seen in our reopening plan, our phase 2 does include at some stage in phase 2 opening City Hall, and phase 3 all the municipal service centers. So the reality is over the coming weeks and into maybe a couple of months, we're going to be opening much more of our work. And so from Elizabeth's perspective, yes, if this was I only need folks till the end of September, we probably could have figured out a way internally to work this around. But Elizabeth is trying to set this up for at least this year, and by all accounts, some level of staffing increased level heading into 2021. We hope that doesn't happen, but we're not convinced of it. So your point is well taken. If you take today and maybe the next 2 months, we would certainly have a little bit of flexibility with staff. But in terms of this whole run through to 2020 and into 2021, no, those staff will be very soon going back to their original jobs as we begin to reopen.
Councillor Ferguson,
do you have an approximate date, Paul, when you're going to reopen City Hall in the service centers?
So through the mayor, we're just finalizing that, and next week we'll be able to announce some of those timings. We're just the work done from a facilities perspective, so we're really close, and it will actually be next week. We'll be able to give you those.
Okay, and my last question is,
timing.
Typically, even in health, 75% is funded by the province. I know that's been under review, but typically 75%. What's the probability that the fund will, in your best professional opinion, what's your best guess? What percentage of this the province will cover of this additional 92
Through you,
staff?
Mr. Mayor. So just wanted to make one point as well related to your earlier question, Councillor, is the assumption that we have made in this is that we would bring on 50% of those staff by August the 15th and then another 50% of those staff by October 15th to account for both that continued redeployment of other staff, but also for the recruitment efforts that we would be undertaking in order to fill those positions. So we are making assumptions of continued support, and that's been taken into account when it comes to the dollar value. In terms of best guess going forward, so we do know they had already changed the funding formula from 75-25 to 70-30, and that's the assumptions that are in our ASP budget as we go forward. In the past, in situations such as this, they have given 100% funding, and that has been my experience routinely in these sorts of in terms of the province's decisions around funding these sorts of efforts. I would say in this particular instance, this is highly unusual. This is not at all similar to what we've experienced before. We know each level of government is cash strapped. And so they are all looking at ways to be as economical as possible. And so that's why we are seeing some redeployment of their staff to these issues and being offered up to help as well. And we do take advantage of those wherever we can. That said, I'd really just be guessing in terms of what we can expect from them. It would be I would say it would be unusual for them not to do 100% based on past practice. This isn't usual times. It would be unusual as well for them not to do their share on public health programs where it's clearly something that is public health work. If it were something that was not clearly public health work, I could see them saying, no, that's a local decision. Go ahead and fund yourselves. But ultimately, it is the board's decision about what level of resources to provide and to make those requests.
Okay, and I heard you say this board health has to.
Well past it, Lloyd.
Can follow up. So in the I heard you say, answering your previous question, it's a board of health decision. So can you report back to us how soon can you report
Mr. Mayor,
back to us
that
what the province is going to do?
also not in my hands. They have said that we have emphasized to them as medical officers of health across the province that these are decisions that we need to get answers on in a timely way to support our boards and to support the risk that is being taken by our boards of health in both deciding around funding and as well having programs that aren't up and running quickly across all the many other areas of programs and services. And so they have come forward and said they will be asking us for those by the end of this month. And we're hopeful to reply soon after, but I can't promise you anything more than that.
So,
thank you, Councillor Ferguson. If you want to get back on, we'll put you back on. To be fair to everyone else, we've had that 5-minute limit operating here. Okay, I'm going to go to Councillor Danko and then Councillor Partridge and then Clark for a second time. Councillor Danko.
Thank you, Mr. Mayor. My main question about why now and why not in April and May, I think has been answered with the discussion with Councillor Ferguson. I do have a follow-up question to Dr. Richardson. Back at the beginning of kind of our response to COVID in March and April, I think there was a call out from various allied health professionals, their professional organizations, and related healthcare fields for emergency response volunteers to assist with things like contract tracing and manning the call centers. So these would be people that do have healthcare experience, but depending on their current situation, might have time to provide volunteer services. And I don't think that ever really went anywhere or was really taken up. So my question to you would be, is there a possibility of any of these positions being on a volunteer basis, or is there a specific reason why we're looking to go to a paid position as an
Through
FTE?
you, Mr. Mayor. So the programs I'm aware of were a means to provide a pool of individuals who are interested in being hired for work, as opposed to being, they're volunteering to come back into the workforce rather than volunteering to do the work. There was discussion about students and the role that they might play. And of course, we do work with students on a regular basis. And so much work that we have done has been dependent on several of our residents and infectious disease residents who we don't fund at all. They are, of course, paid positions, but they have come to work with us on this work, and we'll continue to look at students and the role that they can play in helping us with the work that we do. The universities, though, of course, are also very interested in making sure that their education is well-rounded, and so we're not sure how much of a resource that might be. But Jen, as our chief nursing officer, is working with the nursing faculty at the university. We continue to work with others at the university around other resources as well. So we're absolutely going down that vein too.
Thank you, Doctor. And just one last question on a specific issue. We're in summer now, and one of the programs that has been not pursued right now, just because of the resources that clearly that public health has available, is enforcement of West Nile virus and standing water. And I had a discussion with bylaw if that could be transferred over to bylaw. With these additional FTEs, is that program and other kind of similar routine public health tasks going to be retaken up? Is that part of what we're looking at?
Through you,
Doctor?
Through you, Mr. Mayor. Yes, absolutely. West Nile virus is, of course, especially this time of year, one of our priority programs that we're working to reopen. And so they are doing that work. And there are some elements of that work, like that are challenging to get, that go down more into our yellows and greens that would go forward. But yes, the majority of that. I'm just going to turn to Kevin, who I believe is on as well, just to see if he wants to add anything about West Nile virus.
Through you, Mr. Mayor. Thanks very much, Elizabeth. Staff within the hazard and vector-borne disease program continue to move the West Nile virus program forward. So not only our baiting, but our traps program, et cetera. So it's well positioned, but to the point of this report, resources within that program are heavily strained comparative to our normal operating function. So as we look at furloughing people back from COVID-19 to their business continuity function, they would resume the full scope of that program. But we're confident with what we're doing now and with our partners, we're in good stead.
Thank you.
Thank you. No, it was just, I know Dr. Richardson has stressed a number of times how the core work that public health does hasn't stopped. And those need for those attention to ongoing seasonal vector-borne diseases like West Nile, like rabies. I mean, all those concerns are still there. They haven't gone away. So I'm glad to hear that this will enable our public health to refocus on some of those things that haven't disappeared just because we have this new threat on that we've been dealing with. So thank you for that.
Point. Thank you, Councillor Partridge.
Yes, thank you, Mr. Mayor. And Elizabeth, thank you for the report. Really appreciate all the hard work that you folks have done and the challenges that you've certainly had over the past few months. My first question is why not apply for the funding first so that you know what you're dealing with? Why not do that? Why hire them first and then go for
Through you, Ms.
the funding after, please?
Report. The work is there now. We have staff that are working on that now from the city, from is increasingly there now and needs to have attention paid to it. So to wait for that funding application process to go forward would be too long. We have staff, and it's something I haven't said, but I really do need to say in terms of the many people who work in public health services, they have done a tremendous work over the course of this. They have worked very, very hard. They have had to adapt and change and do different work than they would normally do work that they never were hired to do or never thought they would be doing as they go forward. And, for many of our staff, they're highly stressed as a result. And we're trying very, very hard to get them back to taking vacations and whatnot, but that is extraordinarily difficult to do because they know as they go off on vacation, they're going to stress somebody else who's staying behind and trying to cover as they go forward. And so just to appreciate the tremendous work that everybody has done, and under some difficult conditions, and we've had tremendous successes and just some really good work. But as we go forward, we do need a sustainable way to move forward that best utilizes our resources. The province is very clear that these decisions are made by the boards, and the boards decide what they're going to do, and then the province will come along and make a decision around their grant that they're going to provide afterwards. So we do this each year when the annual service plan and budget goes forward. You might recall the latest I've ever seen a funding letter around that is November. And so we're going forward with our full programs and services while we await that decision. This year, they're saying they may have at least that piece out to us earlier, but just be collecting the data around what else we need as we go
So
forward.
one of the things and sorry, you're eating into my 5 minutes. So one of the, I don't want to break the rules. So, I mean, one of the things that concerns me is exactly what you just said. At this point, what I'm gathering from previous questions that have been asked is that we really don't know how long the application is going to take before we hear if we're going to get that 100% funding. And this really is a provincial issue. This, everything that we are looking at putting money towards here, if they don't come through with that 100% funding, it still, in my mind, is a provincial issue that they should be funding. So if they don't fund it, where's the money going to come from?
Through you, Mr. Mayor, that's probably a question best answered by the mayor and others. But I just do want to say, absolutely, this is something that we need to ask for. This is something that they have provided funding for in the past, and so, we've got that history behind us, and we're pressing with them. And I think this is where in this letter of correspondence, to be asking for these dollars and to be asking for a timely answer back in terms of where we're going and what we're doing is really critical.
And so prior, you had said to another, one of my colleagues, that you were looking to hire, I believe it was 45 by August, and then that would be the balance, so 47 by October. When I look at the alternatives for consideration, it says an alternative would be to use existing public health resources, and that it's anticipated that with up to 45 FTEs of the 75 would be covered. So if you're looking at doing 45 by August, I mean, I'm just trying to look at, we've got a significant amount of pressure on the city in general, not just on public health, but certainly on all areas, and with the deficit that we're going to have. So I'm very, very concerned about supporting this right now. I have to be honest with you. So what about the alternative?
Through you, Mr. Mayor, absolutely, the alternative is there for your consideration. It is not what is being recommended. We have looked at hiring staff in a way that we think is both responsible and doable. as we go forward. And we have looked at keeping to a minimum what it is that we would need in order to do this work. We don't recommend the alternative because there are many other programs and services that need to get back up and running. There are programs and services that have a significant impact on the health of the population. We think that those need to get going. There are certainly a whole range beyond that we just cannot reallocate. We don't have the skill sets to reallocate to do that. And given the opportunity, we know there is funding that is going to be available through the province. We don't know exactly what, but we know that they have told us there will be dollars available for public health for the response. These are the risks that we have to balance. And so the recommendation is to hire them, ask for the funding, and get an answer. You do the elements are broken down as well, so you could decide to approve some and not others. Approve the core public health staff and decide not to take the risks on some of the others. I would note if we don't go forward on the Chronos, we actually need more staff in order to do that work as well. So just something to note there.
All right, thank you. And the alternative for consideration still being on that, if we did go for that, you can still apply for the funding. Is that correct?
Through you, Mr. Mayor, we would still be applying for about $1 million in extra funding over and above the 1.6 million and the 265,000.
Okay, so the answer is yes. Yeah, okay, thank you. And just coming back to the hiring of staff, would you be using healthcare related temporary agencies to hire these staff? What would be the process that you go through?
Through you, Mr. Mayor, we do not generally use agencies for the type of staff that we're looking at hiring. If you're by agencies, I'm assuming you mean to hire through a temporary services agency, as opposed to a recruiter.
One specific to healthcare, though, because there are temporary agencies that are specific to healthcare. So I'm just wondering if that would be part of the process that you'd be looking at.
Through you, Mr. Mayor, when it comes to the types of positions that we're looking to hire, there aren't temporary agencies that provide these types of staff, public health inspectors, public health nurses, as opposed to RNs or RPNs.
Right.
Those sorts of positions are not ones. No, but for administrative staff, that might be the case.
So I'm talking specifically healthcare, though. But I think the answer was no. You did mention, though, that in the past you've received 100% funding when you have applied. And I'm wondering if you've ever applied for a large number of employees and received 100% funding in the past.
That's a good question. And tapping into my memories, we've certainly applied for large numbers of dollars. I'm not remembering from H1N1, from SARS. We certainly had significant numbers of dollars. Again, the staff were hired, people were doing the work, that we were doing the overtime, whatever it may be, and then we're coming back to ask for dollars in those cases. With rabies and those sorts of things, we have been asking for staff on an ongoing basis and been receiving that funding.
I really appreciate your answers. I'm having a real challenge with supporting this, but I do appreciate your answers. Thank you, Mr. Mayor.
Thank you. And I'm going to put myself on actually at this point. So just to be clear, Doctor, the alternative does suggest that if we go down that road, that we will be foregoing work on pest control, school dental, visioning, screening, school programs, so urgent system support services, healthy growth and development programs, sexual health clinics, smoking prevention. All of those would have to be set aside because you don't have the resources to focus on both, right? Which is why you're asking for the fuller complement, so you can do not only the COVID-related work, but the work that is West Nile came up earlier, but all these other services that are critically important as well, but may not be doable due to the shortage of staff.
Through you, Deputy Mayor, that's right. And the other piece is that we would not be using, it's not good HR practice. We would not be using staff to their best effect. We would be using staff who are more skilled and better able to do the work that they're skilled and able to do. For many of the positions, we would be, if we hired staff that were more specific to the work that we need to do, they would be more appropriately trained. They would not require the same level of resourcing. There's a difference between using our own staff and using the other staff of about $200,000 just in pay as an example for the remainder of 2020. So it is a more expensive and and overuse. The other thing that's important to note is we're only able to do that because of the EMPCA, the Emergency Measures Protection Act. And so that is why we could do that now. That is why we could continue to do it. But as soon as that act is taken away, we would no longer be able to do that.
Okay, thank you. I mean, I have no additional questions other than that, the Premier has been very good on indicating that COVID-related matters, they are going to be there for municipalities. And of course, we're also looking for them to be there for the bigger deficit issue. But on the public health side, that they've actually been very good in flowing additional dollars to deal with some of the public health issues to date. Is that correct, Doctor?
Through you, Mr. Mayor, is specific to this issue. It's been a discussion in the past. They have been, whether it's H1N1, SARS, rabies, those issues, they have been very good about funding those.
Yeah. Okay, thank you. I appreciate that. And I think, you know what, this is important work. And sadly, all the other things are important work as well, especially when kids go back to school or we have sexual health clinics that aren't going to be operating. That has its, overt negative impact as well. And so certainly we don't want that. I'm going to turn to Councillor Wilson and then Councillor Clark a second time. Councillor Wilson.
Well, thank you, Mr. Mayor. I think you've said it very effectively. This is a lesson in prevention, all of this. And as someone online just made a remark that there was an outbreak a few weeks ago, if you recall, in Kingston, Ontario, at a nail salon, and it required over 2,000 tests. When we have even small outbreaks, we need the resources to respond, and I'm very supportive of the recommendations. This is important work. It needs to be done for the benefit and the protection of our children, of our seniors who are most vulnerable, and everyone in between. Thank you.
Thank you. Councillor Clark, you have an addition to the motions A and B. Go ahead, sir.
Thank you. I have one quick question, and then I'll go to the amendment. I thought I heard Dr. Richardson say that they're expecting the funding letter from the Ministry of Health by the end of July.
Through you, Mr. Mayor, the funding letter for our usual annual service programs and budgets, we're anticipating by the end of July, we've been told. And then they will be asking us at that point to submit whatever extraordinary costs we are projecting to year end.
Okay, so is this 100% that we're asking for a part of that annual service plan and budget, or are you now saying that it's a separate ask from that?
Through you, Mr. Mayor, sorry, it's I understand it can be confusing. So
it is, sorry. It's my fault, not yours.
We would have our base budget that we have for public health programs and services. And so that's called the annual ASP&B, annual service plan and budget, that we submit to the province, and we submitted it to the province in February for what we do, year over year. And then with COVID, we have had, more impact, more costs, extraordinary costs associated with that. So they're going to come back to us on our February ask. They're going to come back to us on that very shortly. Is what we're being told. And then they're also saying to us, we know that for many of you, that won't have been sufficient in order to respond to COVID. So tell us, what are the extraordinary costs that you've already expended and that you're projecting till the end of the year? And that will go in at that time.
Thank you.
Thank you. Thank you. So the proposed amendment, Mr. Mayor.
I think Lauren's gonna pop it up on the screen, I think.
Oh, she's the best.
Yeah. So you can and there it is. So adds the words temporary in both A and B for the FTEs that are being recommended.
And I believe Councillor Jackson was going to second that.
Yep.
And I have no comments on it. I think it stands for itself.
Okay. So let's deal with the amendment.
If you can come back to me, I'll make some quick comments after that, sir. Thank you.
So yeah, on the main motion, yeah. So
yes,
on the amendments then, any comments on the amendment? If not, let's vote on the added items on item A and B to include the words temporary. So all in favor or opposed on that? And so far, everyone's able to vote, which has been great. Councillor Pauls and Councillor Jackson, thumbs up. Councillor Jackson seconded it, so he's certainly supportive, I would think. And he indicates so. And Councillor Pauls, I do not see on the call at the moment. Yeah. Thank you. So on the main motion, Councillor Clark, that was carried, by the way, 14 to...
Thank you very much, and thank you, councillors, for your support. So I'm growing increasingly anxious, as you know, Mr. Mayor, with regards to our COVID deficit, the lack of response from the province to the municipalities in terms of here's your money, the lack of response from the feds to the province, to the municipalities, here's your money. The vast majority of our COVID deficit that we have incurred is a direct result of the provincial order by the province. We acted prudently, quickly, and with effect. Our staff in Hamilton have done an excellent job, and our numbers show that across the board. But I have real concerns that we're not mitigating any of these cost impacts, and we're spending before we actually get approvals from the province on the funding. It would be nice, from my perspective, if this motion was contingent on funding from the province. Make it very clear to the province, we can't add more municipal employees on the municipal taxpayers' dollar without funding from the province. The motion doesn't say that. That would be good in my mind. I have to say that when I got the earlier report about how many employees out of 8,200 were not working, and we were told only 42 were not working, I struggled with that, Mr. Mayor, because every time I asked for roads to be repaired, sidewalks to be repaired, signs replaced or repaired, culverts cleared, illegally dumped, everything during the essential service shutdown, we were denied. Can't do that. So we only had 42 people not working. I don't know, there was a lot of work that was not getting done because of the essential service shutdown, and we haven't mitigated. I can't subscribe to the notion that we shouldn't try to mitigate these costs because it would lower the amount of funding that we would get from the senior levels of government. In my mind, we need to mitigate these costs because we don't know what the amount of funding is going to be from the province. And we have some flexibility as we move down that road, but we clearly need to start looking at mitigation, and I'm concerned about that. So I have real concerns with this motion, the way it's drafted, without saying that it's contingent on securing 100% funding from the province. We need to put it very clear, and I know you have, Mr. Mayor, you have been relentless every time I see you on the television and radio, or not see you on the radio, but you know what I mean. You have been relentless in your demonstration that we need support from the senior levels of government, and you have worked well with Mr. Tory and all the mayors of the large urban municipalities. You have been lockstep, is the expression, and I thank you for that. But I think this council needs to send a clear message to the province. Listen, these are costs that we incurred as a direct result of decisions that you made, and we're not criticizing those decisions. We're not disparaging those decisions. They were the right things to do, but at the end of the day, it's the provincial and senior levels of government that should be helping the municipalities to pay for those bills. That's my position. So I'm still debating on whether or not to support A and B without that statement contingent on securing 100% funding. And I'm not asking our staff to curtail all of the other programming. I'm asking us to send to the province a clear message that we want that contingency. Thank you, sir. Those are my comments.
Okay, thank you. And certainly that's been an ongoing message. And you know, to some degree, I can say with confidence that they're going to be there, both feds and province. But I can't give you a number. But I know that those discussions are live. And as I've indicated before, I think their priority process has not been the municipalities. It's been businesses, individuals, seniors, you know, all the other sectors in the economy that need to be buoyant. And so, you know, the message that we've received often is yes, we're coming, but just not right now. So that doesn't give us any comfort. That doesn't give us any indicator. You know, I would love to hear from the federal government and the province that here's a date that we're going to tell you, what your assistance is going to be. The $14 billion that the federal government put out as a broader assistance, only 2 or 3 billion actually is aligned to municipal issues directly. And so our message has been and continues to be that's inadequate, and both the federal and provincial governments need to step up. And my sense of it is they will. Just a question of when. And you know what? We can't go too far down into our budget process without some significant answer. So we have kind of put a fine point on that going forward to both the feds and the province. As of actually yesterday, our conference call with the Premier and Minister of Municipal Affairs, that point was made over and over again, and their assurance was, we're working on it. So that's about as good as we can get at this point. So, but I fully agree, and I think that's a message that we're going to keep hammering away at all levels, quite frankly, through SEM, AMO, Marco, LUMCO, every code you can think of, including personally directly. So on the motion as it's presented, I see no further speakers.
So, Mr. Mayor,
Yep.
am I still there?
Go ahead. You're
Can
still here.
can I just then this is for me, and the councillors may want, and I don't want to support this, but in item D, I'd like another amendment to indicate that at the end of the sentence that the above approvals for the FTEs is contingent on securing 100% funding from the province. If there's a seconder, great.
May you speak? Yes, sure. Go ahead.
Mr. Mayor.
It's Lorraine Kohler here. Councillor Clark, are you proposing a further amendment to the recommendations in the report?
Yes, Lorraine, it would be a motion to amend item D,
Yes.
adding after budget the following. That final approval of the FTEs is contingent upon 100% funding from the province.
And I'll second that.
On 100%.
I heard that. Thank you. Okay.
Funding. I'll share that with the
She'll
group.
put that up on the screen as well as an added amendment. I'd like to. Are you done, Councillor Clark?
Yes. I
Okay.
don't need to speak to it. Thank you, sir.
All right, and so I'll speak to it actually, and maybe not speak to it. I'm going to ask the good doctor the impact of that, because that then potentially sets back not only the back to work process at the city, but the work that needs to be done in public health. So I understand the sentiment. I just don't think it helps us currently with the issues that we're facing that need to be dealt with. So, doctor, what's the impact of having this, waiting for the funding to come in before we actually make the change?
Through you, Mr. Mayor, and I do appreciate very much the dilemma that council is dealing with around this piece. The challenge for us is that we know that the request isn't going to come till the end of the month, which means it won't get in until August, which, everything starts to domino back. And if we wait for approvals, the draft date that was given in an earlier teleconference was that the funding would be announced at the end of November. That is too late for us to do anything, of course, for 2020 whatsoever. And ideally, they will absolutely make that sooner, but that is the only date that we have heard at all through this process. And so essentially, if we were to await that funding, there would be I don't know what dollar value to predict for them for 2020, because then it would be essentially that we're continuing to reallocate staff to these functions. We would have to then continue as we are, not be able to reopen a substantial number of our services, as you see the impacts there, until 2021. I think I just want to say for the school year in particular, as we go forward, and knowing that we have a number of kids who need to be immunized, all the mental health issues we're dealing with, we would not have the staff to do that, to get many of those programs and services back up and running. So just want to be clear, absolutely, it's not to say I don't appreciate the challenge that's being dealt with, but the impact will be significant, and it will essentially mean that we will not be able to reopen a good chunk of our services until next year. As well, I would say when it comes to the assessment center piece, that other 17 FTEs, I would say the council would need to make a decision as to whether or not we're going to continue to provide that function, because it's not a core public health function. And so we would to continue that function through until we get a decision on that funding. It may be a little bit more timely in terms of how it comes because it comes from a totally different area of the province. But if it were to come that delayed too, while we're not able to do other core public health functions, that would be something that council would have to decide where its priorities lie.
Okay, thank you. So additional speakers, Councillors Nan at this point and Councillor Clark for a second time. So Councillor Nan.
Mayor, thank you through the mayor. I appreciate the previous question and the supplementary response by Dr. Richardson. I really appreciate understanding the impact to the public health of our residents and the services that they are relying on and ought to be relying on in this municipality in terms of core set of services that our residents can expect when it comes to their public health. In accordance with the proposed amendment that's before us at this time. And I appreciate where it's coming from. I understand very clearly the financial impact that our municipality is facing and every municipality is facing. However, we do have to make decisions about what we consider and value our investment in. And if there is clear indication coming from the province, and I hope that COVID-19 has been teaching our provincial government the importance of right sizing funding for public health versus continuously undercutting and underfunding public health, given its incredible impact on the vitality of the people who make up this province and our city. So although I appreciate the spirit behind the amendment in terms of the apprehension and concern and anxiety financially in terms of managing the books, I cannot support it as it counters the value set in terms of the priorities that we are dedicated to accomplish and achieve on behalf of our residents. So I will not be able to support the amendment before us. Thank you.
Thank you. Councillor Clark, second time.
Thank you very much. And to respond to Dr. Richardson's commentary, I'd be happy with a letter from the Minister of Health saying we're going to get the funding. Funding may not flow, but that we're going to get the funding. And she has the authority to do that. So not sending the message to the province that we're just going to keep spending municipal dollars until they catch up, I think it sends the wrong message. We have to make sure that we're being fiscally frugal and prudent, and we're already at $2 million and growing. We want confirmation from the province that they're going to pay for this. So that's the intent of the motion. It's not that the funding would flow, it's that they're going to pay for it. Everything, as you know, comes many months later with the province. Every ambulance, everything, we don't get the money right away. It comes many months later. But they give us the advance notice that we're going to get the funding, and that's what we're asking for. That's the intent of the motion. Thank you.
Understood. So I have no further speakers on the motion. I can't support it either, but any additional comments? If not, we'll go to a vote on the amendment. Lauren's put it up on the screen. Final approval will be contingent upon 100% funding from the province. Councillor Wilson. Sorry, what are we waiting for? Oh.
Mr. Mayor.
Councillor Wilson, you're on. Yep.
No, I was planning on speaking to the amendment proposed by Councillor Clark.
Yep, go ahead.
Yeah, thank you. I understand the intent. I understand the frustration. I cannot support the amendment as proposed. I think, again, this is a lesson in the consequence of what happens when we underfund public health. We can't risk the health and well-being across the entire public health portfolio, whether it's West Nile, whether it's mental health, whether it's the ability of public health inspectors to check on and do restaurant checks in order to support our local economy. This is just too important an issue. It requires all hands on deck. As again, I mentioned that one small outbreak in the Kingston Nail Salon required 2,000 tests, 680 people to contact. That requires resources. This is a clear and present threat to the people in this community. And we just have to move forward on that basis. I'm not prepared to put that work in jeopardy. I cannot support the amendment as proposed. Thank you.
Okay, thank you. Councilor Marula.
Thank you, Mr. Mayor. And just through you to Dr. Richardson, have we ever underfunded public health in the city of Hamilton?
Through you, Mr. Mayor, that is a question that is difficult to answer. We have absolutely debated in the city about the level of funding and what is needed. There is always more work that we can do. There are always more things that would be effective here, but what council's role is to try and balance those needs in the community versus the dollars and pieces that are available. And so I know council has been very thoughtful in those decisions each time they've needed to be weighed. And overall, as we've gone through each of the emergencies that we've faced, we have generally agreed to fund, as we did during SARS, and in others, the extra dollars. And we have, I've said before, we have received the funding in return. Just one point to clarify, the indication we've had is that the funding letter wouldn't come till November. Not at all disputing Councillor Clark that it absolutely could come and ideally would come earlier, but it was the funding letter I was referring to as opposed to the flow.
Okay, so through you, Mr. Mayor, if we've underfunded something, could you illustrate exactly what we voted against, which would coincide with the underfunding?
Through you, Mr. Mayor, I would not say that we have specifically underfunded anything. Here in Hamilton, you know that there have been significant, over the course of my 25 years with this organization, we have had significant increases in funding when there have been challenges. I go back to the days of Vicki Woodcox and when I was actually on maternity leave with my first child, when we had an increase of 42 staff during the time when council itself was 100% responsible for the funding. So I would say this council has, in general, actually very much supported the public health programs and services. When we've had challenges was when we're dealing with the funding split and making decisions about what should or should not be done. As I said before, we would not call it underfunding at all. I would call it having to make decisions about what we do, and there's always more that we can do.
Okay, so now that we separated fact from fiction, I want to thank you very much for your time. Thank you.
Thank you. Okay, we're going to go around the loop again. So, I'll speak again then. Councillor Ferguson, go ahead.
Yeah, thank you. I think you did invite me to come back on again if I wanted to, but I don't think the public, with what we're staring down with the pandemic and insurance and waste and the list goes on and on and on, I think the public would understand if we pause pest control. We're not even sure the schools are going back in September. It says pause this service for the dental and vision screening. The sexual health clinics reduced to 1 day per week at the downtown site only. And smoking prevention, just pause it while we get through the pandemic. I think the public would understand that. And so I'm very supportive. I agree with Councillor Clark. We don't need the money in hand. We just need a letter from them saying, yes, this will be funded. And if it isn't 100%, then what is it? Just to give us a comfort level, because we just can't keep spending. We got to start curtailing a few things because these are different times. So once again, I fully support this. I second the amendment to wait for the province to tell us that, yes, they'll fund this. Thank you. That's all.
Okay, thank you. And then for myself, I just simply can't support this. I have more confidence than some of you that the province will come through for us. And you know what, we're playing hardball with the province is fine and well, but there are now folks in our community that are going to be impacted by this. So if this does get supported as an amendment, I'm going to ask Dr. Richardson and Paul Johnson and others to report on the spillover impacts. This is not just the funding issue. This is how do we get people back to work? There's a broader spillover issue here that happens here, and I think we need a full report on that when it goes to council. So if it does get supported, I'm going to be asking for that fulsome report about the broader impacts that are going to be affected as a result of this decision. And you know what, maybe we should talk to the federal government about the spending that they've done to keep our communities and our economies buoyant and people in cash so that they can pay their bills. And the reality is that we're not immune from that either. So far, we've expended what we needed to expend, and I think this expenditure is not going to make a material difference, but will make a material difference in terms of how we come back to bring people back to work, do the work that's necessary. And then when you talk about contact tracing, we're doing more testing than ever. And so, if you get one case, the tracing of that contact is enormous. And in the absence of having the resources to do that, we're actually doing ourselves harm and the residents out there that need all of these services as quickly as possible. And earlier we were talking about, the speed at which a lot of this work is done. Well, this isn't going to enhance it any. So I just can't support it. I understand why you might bring it forward this way, but I think it's going to handcuff our public health, and it's going to handcuff our city staff, quite frankly, in terms of how we bring people back to work. So I can't support it. Thank you. I see no further speakers. So on the amendment, again, Lauren, the amendment was that we get a indicator from the province prior to expending these resources. So everyone's clear. Let's go to a vote. Which will be coming to us shortly. Okay, and that's lost 11-3. Thank you. And I'm going to turn to the main motion as amended, originally by Councillor Clark. All in favor of the main motion?
Can we sever them, please?
Sure. Okay, so we're going to go through A, B, C, and D, all four, I should say.
Yes, please.
Okay, thank you. So give her a moment to set that up. Councillor Pearson, did you want to speak?
Can we see that motion again so I can follow through on it?
Yeah, the only change from the motion in your package is that it adds the words temporary to both item A and to item B.
Okay, thank you.
Yep, you're welcome. So on item A, all in favor or opposed? Councillor Pauls, you're in favor? Hear you.
Okay, I do not know why, but they are marking me as absent. I've been on the video the whole time. So so I don't know why I can't vote.
We're going to get you back into the voting queue, so hang on.
It says I was absent.
Oh, okay. Well, I didn't see you on the call a little while ago, so I don't know where you went. If you turned your video off, that would not
I've been
help us.
sitting here for, what, how many hours? So I just stepped out for a second. All right.
All right.
I'd like to vote on this one. I'm a yes, but.
Of course.
Mr. Mayor.
Yes, sir.
It's Councillor Clark here. I made an error. I wish to oppose A, but I'm supporting B, C, and D, and I pushed yes for A. If the clerk could correct that to no for A, I would appreciate that. Sorry, sir.
No worries.
Through the chair, it's Lorraine here. I have reopened A, so Councillor Clark, I believe you can vote correctly this time. And Councillor Pauls, I believe you are there. So you should be able to vote.
Thank you, Lorraine.
You're welcome. That was, and Councillor Pauls, that was my error. I apologize.
No problem.
Councillor Pauls,
Yes, now I am.
okay, thank you. Subsection A is 11-3 in favor, and we're going to go to subsection B. Problem? Fortunately, separating them out makes a little bit of work, but we'll get there. Thank you. Need to separate C and D.
No,
Thank you.
sir. Actually, B, C, and D, I would be voting all the same if it's just, but I don't know what my other colleagues want, so that's why I asked to sever everything.
Okay. Yeah, we got a nice shot of Councillor Farr's ceiling, but can't see Councillor Farr. There you are. You're here. Okay, present and accounted for. And you've been voting, I take. Okay, so we're at, so that's B. So let's just finish up on C and D then. Let's just, Councillor Clark, you on B as opposed. We should be able to hear you. Yep. Go
Sorry.
ahead.
On B, I support B, C, and D. Nothing's coming up on my screen to vote though, sir. So
Councillor,
on B, thumbs up.
Okay,
thumbs
thank
up
you.
subsection
On B, thank you. Yeah, let's just finish C and D as in this process. We've separated them now, so now we're just going to follow through. So on C, all in favor? Or opposed? As it comes up. Thank you. And item C, that one's carried 13 to 13. 13 for present. Sorry. Both C and D? You did them both? Okay. You all clear on that? That was C and D at the same time. Okay. Seeing everyone being comfortable, thank you all. And we're going to move on to item 10.5, which is the face covering in enclosed public spaces. I'm going to turn it over to either Dr. Richardson or Dr. Tran has been kind of leading the fray here. Dr. Richardson, you want to lead it off?
Yeah, I will lead it off, Mr. Mayor, if that's all right, and then I'll turn to Dr. Tran. As you're quite right, he has been uh, doing yeoman's work at getting all of the information together, reviewing, considering, discussing with all our colleagues. And I do want to just acknowledge as well our colleagues, Monica Cirillo from MLE and Michael Kine and Jenny as well, one of the other staff. And I know we have another one of our legal colleagues on today, but it has definitely been a team effort in putting this all together, and very grateful
And before
for that.
you get too deeply into it, I did need to mention to council that if we get into constitutional or legal issues around this issue, then we do have to go in camera at that point. So, you know, in terms of the masking and the public health issue or recommendation, we're fine. If you get beyond that, there are in-camera legal issues that we'll have to deal with if we need to. Sorry, doctor, go ahead.
No problem. Thank you. So just as you know, we have been dealing with this pandemic since March 11th, and to date have investigated over 850 cases of COVID-19 here in Hamilton. And while we are currently stable, as we've been talking about, and we've entered into as a community stage 2 of the reopening process, there is this ongoing risk for spread of COVID-19. We do know from looking at other jurisdictions in the world, and as we do on about a monthly basis, we do a kind of global review of where things are at, but of course keep track on a regular basis. In any case, we do see that there are resurgences that happen and have been happening since reopening has gone forward. And so, of course, there are some of those in the United States in particular that are probably best known, where they've actually had to return to lockdown measures and those sorts of things. This is definitely a new virus. We are definitely have a lot to learn about it, and of course, we're really hoping to learn a lot about a vaccine or a treatment and get that up and going. But we're a good 18 to 24 months minimum away from that, and you'll see many people talk about how that may be very optimistic even at that time frame. So without those things, and the fact that we are widely susceptible still to this virus, with the early seroprevalence surveys really showing that we've done a really good job in protecting ourselves against it. But at the same time, what that means is we're all still susceptible to it, and so we've really had to rely on public health measures, the hand cleaning, the respiratory hygiene, the cough into your sleeve, the physical distancing, the staying home when you're sick, and the recommendations around mask wearing to prevent the spread of this virus. So we do know that in order to prevent the sorts of situations that we saw in Italy and in Spain, where there was overwhelming of the healthcare system with the number of people who were ill, and they had higher numbers of cases and deaths, that we did go to these lockdown measures, closing down business, closing down personal services, closing down aspects of healthcare, closing down many things with all the attendant negative impacts that come with that. Whether it's closing down our schools and the impacts on our children, it's closing down business and the impact on jobs and the availability of and supply of some products that we absolutely need, and healthcare and personal services as well. So as we ease up those restrictions in accordance with the provincial reopening framework, we are very much needing to continue to rely on public health measures. And while we're considering this masking or face coverings bylaw, it by no means replaces the fact that we still need to do all those other things. And that's absolutely paramount as we go forward. But as we reopen, we are considering, what does need to be in place based on what we're seeing. When it comes to masks, the science around masks is by no means definitive. I wouldn't want you to think that there's, absolute clarity around those points. And I've certainly experienced from my colleagues in healthcare and others that, they do question some of those issues. And of course, there'll be other objections that are raised around mask wearing. But what we do see when we look at what we know from the evidence that's being generated around the globe, when we look at other countries, we have over 100 countries now that have adopted mask wearing. There is evidence that it is effective and is a part of the control measures that we can keep in place to prevent the spread of COVID-19. The jurisdictions that have seen it, that have done it, have seen that more people do comply in the wearing of masks. So enacting the bylaw is both a tool that could be used in terms of enforcement, but it's part of communicating the importance of mask wearing. And as we know, most people will be compliant when we're talking about those issues. What we're looking at with evidence is we probably need to be up at the 80% range is the more recent evidence in terms of mask wearing. And that's what we're aiming to get to. And so this can play a significant role in getting us to that level of mask wearing. There have been surveys that have been done in Canada and in Ontario specifically. We have not had the resources to do one of those here in Hamilton, but from other parts of our country and our province, it has been seen as an acceptable measure and a non-invasive way to help control the spread of COVID-19. When we talk to our colleagues who have begun this, and we know now that over half the public health jurisdictions at this point in Ontario have adopted this measure. So this includes Ottawa, Kingston, Durham, Toronto, Mississauga, Waterloo, Windsor, Simcoe, Muskoka, Sudbury, Guelph, London, and many more that I'm not thinking of off the top of my head. But many of them who adopted early, like Guelph and Windsor, that they are seeing that this is both acceptable to business and acceptable to the individuals, and they are seeing impacts on mask wearing in those areas. It's suggested, as I said, it may be a visual cue that the virus is still out there. We need to take those other measures. And I certainly wouldn't want it to be interpreted the other way, that it's all we need to do. So we do still need people. If you've got a mask on, it's not now that you can be closer in a grocery store. You could be closer in a setting such as that. But in fact, you need to have that as well as those other things. The province has said their preference, rather than to adopt a province-wide standard, is much like with reopening, to start to do these things on a regional basis in response to local needs. And so they have said they're turning to local areas to make those decisions around masks. So given that it is an effective, it's been seen to be acceptable, it's relatively non-invasive way of protecting ourselves, and remembering as well that my mask protects you and your mask protects me. This is a message for a method, I should say, for what we call source control, as opposed to being so much protective against getting infected with the virus. We very much depend on each other in the use of this method to reduce the risk of spread of COVID-19. So for those reasons, we're recommending to council that we do go forward with a mask wearing or face covering wearing bylaw. There are specific areas, it's inside public spaces, that we're recommending that the bylaw be enacted to address. When you think about the broader picture, we have, again, other levels of government that are addressing the issues inside workplaces per se. So Ministry of Labor and the guidance that they have put out, the inspections they are doing addresses those settings. Education, the Ministry of Education is deciding what to do. And again, we heard from the minister today to be looking at local conditions, but they are setting out the parameters around that piece as they move forward. But in the public space, that's where the municipality under the Municipal Act has the ability to address the issues that happens in public spaces. Given that indoor spaces are higher risk for transmission of COVID-19 because you tend to have people more closely together, ventilation in those spaces is more confined, and we don't have the benefits of broader ventilation, UV light, and all the things that come with outdoor spaces. We are restricting the recommendation to being to relate to indoors. There are several exemptions, as you'll read in the draft bylaw. These include exemptions for those who are incapable of wearing masks because of medical conditions, and we would be, satisfied with somebody expressing that that was an exemption that they qualified for. Children who are under the age of 2 or children under the age of 5 for whom a parent or caregiver has been unable to convince them to wear a mask, knowing the challenges that that can raise, as well as several other exemptions that are there. So that is the sort of high-level overview, and I'll turn it back to you, Mr. Mayor.
Okay, thank you. And can I have a motion to put the report on the floor, please? Moved by Pearson, seconded by Nan. Okay, that's appropriately moved and seconded. And I've got a speakers list of Councillors Marula, Ferguson, Jackson, and Farr. Councillor Marula and Clark. Go ahead.
Thank you, Mr. Mayor. Dr. Richardson, obviously this is an issue that has been politicized. The mask issue related to COVID-19 has been politicized south of the border and elsewhere throughout the world. And one thing I find astounding throughout this COVID-19 crisis is the inability for the Americans to do the right thing and politicize. Could you just elaborate again? And you've mentioned that this is not a definitive science, but the most salient point to this is the fact that the wearing of the mask is more to do with protecting others than protecting oneself. Can you just elaborate on that, Richard? Incredibly
Absolutely,
salient
through you,
point.
Mr. Mayor. And this is an important thing to understand about the cloth mask. So these are non-medical masks that we're suggesting. And in medical situation, the mask is designed, the person is trained to wear masks, type of mask that's used. It's there to both protect others from them, if that were to be the case, that they were ill, but it is absolutely there to protect them from people who are sick. And so it has a very important role to play in keeping our staff in the healthcare system healthy. In this sort of setting where we're recommending non-medical masks, these masks may have some role in protecting them from droplets from others, but their primary way of working is to contain those droplets and stop them spreading to other people. And so that is the main reason why we're looking at these masks.
So individual rights exist for individuals, but when that individual's right now intrudes on somebody else's public safety, you no longer have that right. So these individuals that are proclaiming this human rights component, I'm not going to bring up the human rights issue, but these keyboard morons who believe that they're in the right on this, I think are not only truly selfish, but should look no further than the fact that when they put their seatbelt on, they've been accepting some liberties have been taken away from them for years. And there are smoking bylaws. There's so many examples. And the fact that they would look at a global pandemic to bring or to have this nonsense surface just goes to show that this new wave of keyboard morons out there who are masquerading as journalists, politicians, now scientists, is really a true threat to the fabric of our society. And we truly need to get ahead of this. And I reject any nonsense associated with anything that politicizes a global pandemic in the name of politics. Anything Trump says, run the other way. So if anybody doesn't like this mask idea, you know what? Buffalo's not too far away. Feel free to move there. Thank you very much, and I appreciate your time. I strongly support the mask initiative, not to protect the individual that doesn't want to put it on, but whoever that person may become in contact with. So deal with it. Thanks very much,
Okay,
Mr. Mayor.
thank you. Councillor Ferguson, go ahead.
Yeah, thank you, Mr. Mayor. And Mr. Mayor, I've really been struggling with this one, so much so that I dreamed about Councillor Marula last night. And
was that a dream or a nightmare?
There's something about needs and wants. I kept going through my head that the Councillor Marula speech that I hear on a regular basis. But you know, it's a questions to Dr. Richardson, because I'm getting a lot of emails in both directions on this. And so you cite new studies that show that it can have health benefits. When in April, not only did our health department, but the provincial health department and the federal health department say they weren't necessary. And that was in the height of the pandemic. We're down to very few right now. Our hospitals are pretty well empty. I know St. Joe's doesn't have a single COVID-19 patient in their hospital now, at least if you can believe the news. I saw that. The province is saying no. And so I think you answered the question, but it sounds like a subjective decision. I don't know whether you've been influenced by politics on this thing, because it's definitely a change. And you know, there's a lot of criticism in the U.S. about mixed messaging, and I've always been proud that here in Hamilton has been a very consistent message from our health department, and we've always taken the recommendation from our health department. But this is a change. And you're doing this in August when we're significantly lower, but it was not necessary. Grocery stores were still open then. Walmart was still open then. Hardware stores were still open then. Liquor stores were still open then. It was okay not to wear a mask at the peak of this pandemic. And so I'm really struggling why you changed your mind on this. Because I see lots of studies being emailed to me saying that masks can be detrimental. So can you please share with me very briefly again why you changed your mind?
Through you, Mr. Mayor.
Doctor?
Okay. And I appreciate you raising that. And I know it's frustrating as we come forward and we have different recommendations that come over time. And absolutely that happens. And that happens in all of healthcare, you know, that our thinking evolves and we develop new evidence and recommendations change. And with COVID-19, it's happening on a quicker scale than perhaps we might otherwise see in other areas. But in this particular case, you know, early on in the pandemic around wearing masks, there were sort of two imperatives. One was that we were in very limited supply for PPE, and we wanted to make sure that the medical masks that we had got to the healthcare workers that needed them, that had the highest risk. And so that was one of the challenges. The second piece, though, was that we were concerned, as we remain today, that people may not use those masks correctly. And in so using them, they may actually increase their risk. And that is there of getting infected. So if they're touching the mask or they're touching their eyes when they're touching the mask, or, you know, they're doing things that they don't know how to use, then that is definitely a concern. And one of the things I talked about at that point was we would need a significant education training program in order for people to know how to wear them if we were to go forward with this. And that's essentially what we've been doing is going through a training program, as I often refer to, in order to best understand what we need to do in order to prevent the spread of this virus. I can remember, you know, trying to convince people that you really did need to stay home if you were sick, and that that should really be the standard all the time. But in this case, it's been about how do you wear a mask well. So we, you know, since the Chief Public Health Officer, Teresa Tam, came out and recommended these, you know, after much discussion locally and around the world, you know, we have been recommending them for use here in Hamilton, strongly recommending them. And so that has been going on the last several months. And then as the stronger around its use and the fact that it can really make a difference, we're looking at ways that we can increase mask wearing, you know, as we've looked what proportion to do that proportion slightly higher than it was before. We've seen that these kinds of measures can be effective at getting those proportions higher. So it is that evolving evidence that really has led to the recommendation.
Thank you.
Why wouldn't if your concern is about preventing a second wave, see updates daily so you know if it's happening, why wouldn't we change to mandatory masks if it does in fact happen rather than now? I'm just worried about everybody trusts our health department, but you've changed your mind now, and a lot of people will lose that trust because the political world or the infant will go around, why isn't the province doing this? And it casts in their mind. And so if we're doing a second wave, if you're worried about a second wave, why don't we watch and see if the infection rates start
Through
to
you,
go up
Mr.
again
Mayor, and
and then
I
make
do
it
want to address the
mandatory?
issue of political influence. It's the second time you've raised it. And I want to be very clear that this is, not the rationale that I base my decisions on, nor do my colleagues within public health. We're very aware of political circumstances. That's our job to be that. But it is also our job to provide you our best professional advice as we go forward. And that is what we're doing. Dr. Tran is doing that. I am doing that. And this is absolutely where we're coming at this from is our best professional advice based on the evidence and what we see today, and that includes in anything we look at acceptability, whether it's going to be effective as a result of that in terms of going forward, and that's what we have seen. So that is where we're coming from in terms of waiting to do it. The challenge is that we know as we address this issue, as we address COVID-19, that when we start to see that increase in cases, that increase is happening, that the increase that we see is after at least 2 weeks of things going on within our community. And so it takes time for people to get sick, to get tested. We know that there are far more cases, we estimate in the range of 10 to 100 more cases than in the community, and we know that virus is therefore very much here. We do continue to see cases, continue to see circumstances where there are spread that are relevant to the measures that we're talking about in this bylaw, where this bylaw could make a difference. And so, we have seen places where they've had that resurgence, they've had to adopt these stricter measures again, and that is not what any of us want to see. We do not want the economic and social impacts from a professional perspective that have gone on. We're trying everything we can to both prevent the transmission, the spread, and the impacts of other measures. And so this is felt to be a relatively non-invasive. As I said, it's been found to be acceptable through surveys that have been done, but also in those jurisdictions that have preceded us in doing this, and welcomed by business and by others. And so that's the reason that we're
Okay,
recommending it
thank
now.
you. And that's your 5 minutes, Councillor Ferguson.
Okay,
Thanks. You
put
can
me
get
back on the list.
if you like.
I have more questions, will you please?
Sure. Yeah, you're back on the list. Councillor Jackson. Oh, so here's the list. Councillors Jackson, Farr, Clark, Danko, Pearson, Collins, Pauls, Johnson, Wilson, Partridge, and myself. Councillor Jackson.
Thanks, Mr. Mayor. Dr. Richardson, very contentious one, not an easy one to deal with. So I'll give an opening remark, a series of questions, and a closing remark. I'll try to get it done within the 5. The opening remark will be similar to the previous discussion on 10.4, Doctor. You and your team have done an amazing job in Hamilton. 550,000 people, only 840 positives, sadly 44 loss of life, but in a city of 550,000. Once again, congratulations, and to Hamiltonians. I say that as a preamble heading into this item. So, Doctor, under C and D, if we approve your recommendation on 10.5 of wearing a mask, the dilemma C and D are going to cause us in our community is going to be awful. The mayor's going to ask the province to impose the same wearing a mask in their buildings in our city, and the mayor is going to ask the federal government if they'll impose the same wearing of masks. Don't you see how this could potentially put us at odds and be somewhat of a dilemma that here we are, if we approve this today, within the city buildings and within going in grocery stores and that we must, but the province and feds, well, they may or may not do it. Through you, Mr. Mayor, please, for a comment from Dr. Richardson.
Doctor?
Through you, Mr. Mayor, I think where staff are coming from in terms of the recommendations we have before you is that we're looking to allow other levels of government to legislate where they have power and authority to do so, and they are certainly doing that in terms of the recommendations they're making to long-term care homes, to hospitals, to healthcare workers, to all of those as they go forward. The Ministry of Labour is doing that in asking them to use the full suite of control measures in business as they are opening and advising them what to do. And so we see that they're doing that similarly for the federal government in terms of what they do. So we are looking to address the areas where there is not that going on. I might turn to legal just to ask, particularly around your question of provincial and federal work buildings, if there's anything more they would want to add, but we're trying to address that area. And there's nothing that would stop the province and the federal government from saying, hey, in the local areas, they've decided these are very important to do. And so we're asking our employees to follow the same local bylaws that are being put in place.
Okay, I see Michael Kine. Go ahead, Michael.
Good afternoon, everybody. Through the chair, I think recommendations C and D are, as Dr. Richardson said, an attempt to request that senior levels of government impose similar measures so that we have consistency across the municipality. The facilities or establishments may be owned or operated by institutions other than the city or private
Thank you.
institutions.
Councillor Jackson.
Thanks, Deputy Solicitor Kine and Dr. Richardson. Further, by the way, Mr. Mayor, I think I've shared with you leading into today's meeting, the response in my office, both within Ward 6 and I'll say across the city into my office has been roughly 50-50 on wearing masks or not. Dr. Richardson, let me give you a real life example that I happened to see and witness myself yesterday, real quickly. And you're going to tell me how you, Public Health Services, MLE, Hamilton Police Service, all are going to potentially deal with this real life example that I witnessed in my ward yesterday. I was standing outside an ATM, standing outside it, and I watched a woman go in with a mask on to do the financial business she needed to do at the ATM. I watched 3 other gentlemen walk in without masks, and I could see inside the window, I was safe distance with my mask on, I could see from the window how angry she was with the 3 men who walked in without masks, who within those partitions were less than 6 feet apart from her. If this gets approved today, I witnessed that, or she wants to file a complaint, how is that going to occur? Who's going to respond? You're going to have the police respond and quickly tell those 3 guys, get out of there, MLE, your staff, Mr. Mayor, through you, because I think that's a legitimate
Through you, Mr. Mayor,
issue.
just to start us off, and then I'm going to turn to Monica Cirillo because MLE is going to be taking the lead on enforcing this, and I wouldn't want to speak for them in the approach they're going to take. But just to note, there would be signage that would be required to be posted in these businesses, and so we're expecting that would be there. Part of what we're doing is creating a culture of mask wearing so that people would be aware of. That's the expectation that we all have of one another as we're going forward. And so that would certainly be part of the influences that we're asking to be there for people when they're going out and about, in the clarity in terms of what is
Monica.
Perspective. I'm going to turn it over to Monica.
Through the chair, Councillor Jackson, to Dr. Richardson has said, we do want to take it as an approach where we're sort of changing the community culture. So there is onus on both the individual that is to be wearing the mask or the face covering, as well as the operator of the establishment. So if, for example, you were in an ATM and there were staffing that were there would be an expectation that they would ask those 2 gentlemen to either wear a mask or, as our bylaws states under 2.4, they would be asked they want to file a complaint with our office, we can absolutely go in and respond, but that would be reactive. So when we see MLE coming in and enforcing, it would be proactive in the sense that we go to establishments, we check for signage, we provide education. But when complaints come in, the city is fairly large and we may not get there when those 2 gentlemen don't have masks on at that time. But we will certainly do our best to make sure that we're following up and
Acting Director Cirillo, good luck with that one and good luck to the bank manager on my example. Thank you. Yeah, I was being a little cheeky, but I accept what you're saying with the hope that you're directing your answer to. Quickly, Dr. Richardson, on Roman numeral 3 of your A part and other reasonable accommodations. Well, boy, if there's ever a wide open statement with not a direct affinity on it, that's one of them. What do you mean by other reasonable accommodations, Mr. Mayor, through you?
Thank you, Doctor.
Through
you're
you.
under the 5 minutes, so I'll get you to go back on after.
Okay, I will.
Through you,
Doctor?
Mr. Mayor, in terms of accommodations, I mean, the majority of those are spelled out within the bylaw itself. And so those include the medical exemptions. They include the exemptions for those under 2. They include exemptions that would relate to human rights, those sorts of issues. And so I might turn to Mike to be a bit more specific about those elements.
Michael?
Thank you through the chair. Dr. Richardson is exactly right. That is just a summary phrase, exemptions found in bylaw.
Hey, Mr. Mayor, put me
in
back on the
part
list,
4.
please, because I have one more question and a closing
Thank you.
comment. Thanks,
Councillor
Mr.
Farr?
Mayor.
Mr. Mayor, for all the reasons indicated by our medical officer of health, whose guidance is based on an obvious expertise that none of us has been successfully adhered to date here in the Hammer. Email objections to was able to hammer me about a week ago during the public discourse that will continue, I'm sure. But then the finance minister offered a snapshot 48 hours ago. And the last thing we need, as you have already said to the media in the last 24 hours, is a second phase, Mr. Mayor. So we don't need a Texas, we don't need a Florida, we don't need any of these southern states that are horrifyingly reliving a whole new phase of outbreaks. The only real downside I see, and I appreciate the previous speaker's comments, and I know we're probably going to hear a few more about, well, how do you enforce it? That's something you might want to grasp onto if you don't want to go with what's before us here, and you want to vote against the masks indoors. But I think we're likely to go from just watching the mask versus no mask in-store conflicts on TikTok to seeing them live and in person. And the previous speaker obviously had witnessed something maybe not as bad as some of the ones down south in the social media, and even a few here in Canada. But if that's the only issue where person A who walks into the Walmart and doesn't want to agree with the greeter, and the rest of us have to endure walking by the conflict, the brief conflict of the store manager or that person in wherever it is who's been sequestered to deal with the enforcement as it happens. And an unfortunate argument occurs. I think that should be the least of our worries, given the magnitude of the situation as it stands right now across this country and in our city. I mean, we've been going on and on about the issue from a financial perspective today, and just about every standing committee we're bringing it up, and it's for good reason. And so it's for good reason that we are taking this initiative. And I'm sorry, but if we're going to argue the enforcement, and we only have, I don't know, Monica, how many, through you, Mr. Mayor, municipal law enforcement officers do we have to cover the whole city? Approximately. And how many bylaws do we have in the city of Hamilton?
Oh, gosh.
Yeah, exactly. Look at folks. We said don't smoke in parks anymore. Not everybody agreed, but most people stopped smoking in parks. I could go on and on and on and give you examples where people police themselves, where citizens do the right thing. We'd be doing the right thing by supporting this today. And so as much as it has been interesting and 50-50 for me on the comms too, and I've been reading all of it, this is the right thing to do at the right time. Thank you.
Councillor Clark.
Thank you, Mr. Mayor. So I have a couple of questions for Dr. Richardson and for our legal staff. So when I read the bylaw references the Emergency Management and Civil Protection Act. There is no reference in the bylaw that I can see to the Health Protection and Promotion Act. And yet it's the Health Protection and Promotion Act that gives the medical officer of health the authority to issue the orders that we're talking about in this bylaw. And the act that is referenced to the province. So I'm trying to understand why would our bylaw frame an act that empowers the Premier and Cabinet, and it doesn't reference the act that actually gives the Section 22 order authorities to our medical officer of health?
Dr. Richardson, you want to start there?
Sure, Mr. Mayor, I'd be happy to start. So I can understand, like, there are different pieces of legislation are all relevant in this situation, and there's different approaches that are being taken across the province as we go forward. And some of that is, because things have had to be put in place in a very quick fashion, as happened in the outbreak the councillor will refer to earlier in the nail salon. And so a Section 22 order was issued there because they had, the 700, nearly 700 individuals that were affected, and they wanted to make a change very quickly. In other areas, such as Toronto, they have gone ahead with a bylaw approach, and that's recommended that we're doing here. So while there are powers under the age permit me to write to require, which that I've suggested here is that we go under the Municipal Act, a different piece of legislation where council has the authority to enact a bylaw, and it allows for this greater public discourse, decision making around which direction we should go in. So these are actually two separate ways that it could be done. There is a third way, which is under the Emergency Measures Protection Act that you just referenced, Councillor, that would be where providing a recommendation would be sufficient. And there are health units that have gone that way, but then it would be time limited to whenever that act is lifted, as opposed to being under the control of council with a temporary bylaw here. So confusing, I'm sure I've only just started to illuminate that, but this is the point at which I will turn over to Michael Kine, and he can talk to you more about the EMPCA and how it relates.
Through the chair, so Dr. Richardson is
you,
exactly
Michael.
right. If you look at the first preamble in the bylaw, it in fact references our statutory basis for the bylaw, which is section 10.
Down a little bit, Michael. We can hear you better.
Can you hear me better now?
Yes.
So to Councillor Clark, if you see the first preamble in the bylaw itself, it references section 10 of the Municipal Act, which is your authority as a council to enact bylaws for the health, safety, and well-being of persons. And that is the legislative foundation for this bylaw.
Thank you. Councillor Clark.
Okay, and so now I'm trying to understand then how we will enforce this when we are challenged through the courts. Because I have no doubt that there will be people who will be challenging this matter in the courts. And it would seem to me that the legislation is already drafted in a manner that gives the medical officer of health the authority to issue the order to wear the masks, to issue an order to quarantine people who have been exposed.
So through the chair, perhaps I can start. So there are, as Dr. Richardson alluded to, a number of different approaches throughout the province. So the three primary ones appear to be the bylaw under section 10 of the Municipal Act, which is what we're proposing. There is the possibility of what's known as a class order under section 22 of the Health Protection Promotion Act. There's also a mechanism under what's the provincial legislation, the Emergency Management and Civil Protection Act, and specifically the regulation that the province recently issued to take jurisdictions to phase 2. And in that regulation, there is a provision that says if you're a business that goes to phase 2, you have to comply with a directive issued by the medical officer of health. And so some jurisdictions are taking the approach, and I think Eastern Ontario is one recent one, where they've said, here is the director from the medical officer of health. We're piggybacking on that provincial legislation, and there's your legislative direction and how we want you to open the facilities. Our approach differs slightly from that in so much as we are seeking that the responsibility be shared not only by businesses and establishments, but also individuals. So from that perspective, we believe and we're proposing that the section 10 Municipal Act bylaw approach is the most comprehensive. With respect to challenges, any one of those three approaches can be challenged in the courts. One wrinkle with respect to challenges under the Health Protection and Promotion fully sitting, they'll be at best operating virtually at the moment. That's the primary mechanism whereby you would challenge a Section 22 order. Both the municipal bylaw and presumably the directive under the provincial legislation would be challenged through the courts, and we would respond to that as we would to any other.
Thank you. We're beyond 5
that's
minutes at this point, Councillor Clark. So do you want to get back on the speakers list?
Yes, please.
Okay,
Thank you.
Thank you. Councillor Danko?
Thank you, Mr. Mayor. I appreciate the Richardson that what is in this report is her professional advice based on her experience as a medical doctor and with her team of medical professionals as well. I think a lot of the resistance that we're seeing to this issue, a lot of the discussion on this issue is a result of the idiocracy in the USA and the people that happen to be in power there. I'm just going to follow up on Councillor Marula's discussion on our proximity to the U.S. and how that might, as a border city, I think we're within around 100 kilometers of the U.S. border. If there's an added risk to that to us as a municipality, when I look at the case statistics in the USA, I think they're at like 3.2 million cases or something like that. I think it's around 26% of the global case number. I think the number of cases per million was and is as we are within 100 kilometers of the USA, and considering that the border is closed now, but people are, Americans are allowed into Canada for business purposes, and there doesn't seem to be a lot of controls on that. And, you know, they are asked to quarantine for 14 days. Again, there doesn't seem to be a lot of controls on that. As a border city, are we at further risk just because of our proximity to that massive
Through you,
caseload south
Mr.
of the
Mayor,
border?
in terms of the United States, that has been a source of our cases over time, certainly in the original part of the experience of this pandemic, a number of our cases were related to travel from the United States. And in fact, three of our most recent, at least, cases have again been due to travel into the US with the essential travel that does continue to occur and will continue to occur as we go forward. So indeed, the number of outbreaks, the disease experience in the US is very relevant to us here in Canada. And whether it will, it's our proximity per se, vis-a-vis the, you know, given that what's happening now is essential travel related to transportation of goods and essential business aspects and family aspects, it may well be just as much an issue for all of Ontario as it is here, but it certainly has definitely been an issue here.
Thank you, Dr. Richardson. My next question is came from a constituent, and they're asking if this mandatory mask policy would apply to schools. And I believe schools are provincially regulated. So how would
Through
that
you,
work?
Mr. Mayor, when it comes to schools, that is an area that is specifically exempted here. The Ministry of Education has been doing a lot of work on this issue about how to best move forward. They are getting at the provincial level, they're getting advice from our provincial colleagues around what to do there, and have other committees that are meeting with our public health colleagues on them. We will definitely continue to work with our local school boards in terms of questions that are local and specific to Hamilton, but we're really all trying to do the work we can without duplicating work between levels, and so we know they've got it at the provincial level, looking at what needs to be there, and we'll work with our local school boards on issues they have that are unique here.
Thank you, Dr. Richardson. And could you just give me just a couple examples of what we mean specifically when we're talking about publicly accessible spaces where this would apply?
So the examples would include things like retail stores, restaurants would apply, and I know restaurants can be a bit confusing because you have to eat if we're opening back up restaurants over time, and so people would be asked to wear masks when they enter into the restaurant, but when they're actually eating, they would be it would be fine for them to take off their mask. So there is an exemption for while you're receiving services. So a service that requires you to remove the mask to get those services, you would be exempt from in terms of that. Mall spaces, but other spaces such as places of worship, recreation centers, community service agencies that are serving the public, any sort of office space where they are serving the public. So we are very much keeping it to the public spaces, whereas the Ministry of Labor would address workplaces particularly. So those are some examples.
Thank you, Doctor. And just a couple comments to wrap up here. I mean, there's no question that it would be preferable for the province to take the lead on this, to have a province-wide expectation. But in my mind, this is all about setting public expectations so that no matter where you are in a public space, you know what you are supposed to do, what everybody around you is supposed to do. And so I'm very much supportive. And as the mayor and others have said, there's very real health consequences if we don't do everything that we can do. And there's also very real economic consequences as well. And the worst thing that could happen to us as a city beyond having future deaths and future sickness is that we end up having to backslide in our economic recovery, which would be just absolute disaster for us and our residents. So I'm just going to finish with a quote from Tom Hanks when he was a COVID patient who's survived, and he was asked about this specific issue, and he said, "There's no law against ignorance. It's not illegal to have opinions that are wrong." And then he goes on to say, wearing a mask is literally the least thing that you can do. So very much supportive. And I think it's the responsible thing for us to do as a municipality. It's compassionate, and it leads to that economic recovery and getting back to the normal that we are all trying to get to. So no question in my mind, this is the right thing for our city. Thank you.
Okay, thank you. Councillor Pearson.
Oh, thank you, Mr. Mayor. And can you hear me? Good.
Yep.
I do have a couple of questions. I guess, are we asking questions in our comments? Because I'll try and keep it very concise. So Dr. Richardson, thank you so much for all of your overview and to all of the work that you, Dr. Tran, everyone has been doing. You're right. We have been very fortunate through all of your efforts in the Board of Health and the staffing in all the various areas of cities. We've been very, very fortunate that our numbers have been lower and we've been able to get a handle on them really quick. So I just want to ask, because I too have been getting numerous emails, and I have to admit as well that it's been pretty well 50-50%. With regards to the comments that I get, people are saying the curve is flattening. Why are we worrying about it now? Can you please just reiterate? I know why, but I think the public needs to understand this.
Doctor?
Oh,
Through
she's
you,
gone.
Mr. Mayor. No, sorry, I
Yes,
hit
you
the
go.
wrong button beside my
Too many reds.
Too many reds. But absolutely, in terms of the why now. And so, yes, absolutely, the curve's been flattening. And there's sort of two main reasons about why now. One is that we understand the information better. And we are seeing in countries where they have done this, in areas where it's happening, that it seems to be having an impact. The science is getting better in terms of looking at it and saying that there is an impact by doing this, that where it's required, people do increase the level of mask wearing. And so it brings it up to the extent that the models show that it will have an impact. We've seen that it's acceptable in terms of people actually carrying it out if it's recommended, that people are willing to do that because it's non-invasive and it's something that they can do to help prevent the spread. The other piece is that the virus isn't gone. The second piece, the virus is still here. We still have cases. We still have suspect outbreaks that we investigate on a weekly basis. We're still dealing with all of those things. And we've seen as well that there are resurgences that are happening in other areas. And there is very much a concern about a second wave. And perhaps the third one I'll add on to that is the piece about the impacts of having to do lockdown. And so we're trying to do whatever we can to make sure that people are still able to get out, to do the shopping they need to do, but that then they're having an impact from an economic perspective with people being able to work and do those things. And so there are all of those reasons why we're suggesting that we do it now.
Thank you, Councilor Pearson.
Thank you, and appreciate that you did mention earlier that Dr. Teresa Tam at the federal level has supported the as more voluntary at that time the wearing of masks. So that has been put on the table. That the WHO organization has not. Have we had any checks on why they have not come out with regards to mandatory masking worldwide?
I wanted, through you, Mr. Mayor, I'll ask Nin to address that one around the WHO.
Sure. Thank you,
Hi,
through
Dr.
you,
Nin.
Mr. Mayor. Hi. The World Health Organization has also modified its position compared to its original. It's not to the same extent as Public Health Agency of Canada or the Center for Disease Control in the United States that support it broadly, universally. The WHO has a statement as of I think June 6th or June 7th about recommending it, but with some caveats in terms of disease transmissions, higher risk. They use a little bit more risk-based approach. Again, that's been over a month ago, so it'd be interesting to see if they update theirs. As new evidence has been coming in the last couple of weeks that we've been seeing.
Thank you for that. So if I can, Mr. Mayor, in closing, just give my comments. I am absolutely in support of this. And I've made no bones about it to residents from my ward who responded that were not happy of my position. I place this no different than the wearing of seatbelts, the smoking restrictions, as Councillor Marula's raised, the alcohol age of a majority for alcohol consumption, et cetera, and purchasing cigarettes, purchasing. These are things we do in the interest of the safety of the residents in our communities. And, I am thrilled that other communities are also taking on the initiatives. This is also not the first time we've taken initiative over the province and putting it in place as a mandatory. We've done this in the past with pesticides. We put forward bylaws before the province did, and they came out after us. So, I'm proud of what we do at the City of Hamilton as a council and as a staff. I think that, I'm very cognizant of some of the concerns residents have raised. I mean, one that really shocked me was that, where we're telling them they can't worship. That is absolutely, absolutely not true. There is no reason you can't walk into any religious church or a synagogue or anywhere with a mask, and that you can't continue to respect and follow through your religious processes. There's nothing. I believe that we have to do this. It's also been mentioned as far as the dollars. I've said all the way long since the beginning of this, we can't shut this country down for a year. We can't afford it. And we're seeing the numbers coming out now. We're at a municipal level terrified of what's going to happen if we don't get funding to cover the expenses that we are incurring currently and not recouping through revenues. So we have to make sure that we get past this. Okay. And I believe that just last, it's that, if we want to get back to normalcy, then we need to take every step that is available to us. And I believe this would be the next one. So thank you, Mr. Mayor.
Thank you. I'm going to go to Councillor Pauls.
Oh, thank you. I thought it was Collins before. Okay, great. Thank you. Dr. Richardson, can you hear me?
Yeah.
Okay.
Go ahead.
Thank you.
I can indeed.
Okay, thank you for all you're doing for us and for your advice. I just want to ask you, when you first started relating the report to us, you said we need a significant education. What does that mean about the mask?
Go ahead, Doctor.
Through you, Mr. Mayor, I was referring to comments that I'd made back in, I believe it was March or April, around whether we would be recommending mask wearing at that time when the evidence wasn't as clear and where there were concerns about people not, this wasn't something people had done. They hadn't worn masks. They didn't know a lot about them. And and so there was concern about would people be able to do all the things they need to do to wear a mask as safely as they possibly can. And so that's when I was referring to now. We've been doing this now for many, many months and talking about masks and all the things that we need to do and how important it is. But there's still, that will continue to be a significant part of the message as we go forward with this, is that when you're wearing a mask, how do you go about doing that safely? And so that means, making sure that you discard the mask after use, that you're not touching the mask, you're getting ones that fit well so they're not bothering your eyes, that you're handling them by the ear loops or the backs of them, depending on the sort that you have, rather than handling them by the front. Making sure to throw them in the laundry, wash them on hot if you're using reusable face coverings. So all of those are the sorts of education things, and that's what we'll continue to do as we go forward with this.
I appreciate that. Thank you.
Councillor Pauls.
Thank you for your answer. But I was wondering, what are the disadvantage of people not properly wearing the mask properly? What kind of infection or would they spread?
So I think that's an interesting question that you raised. I mean, what we're trying to do is prevent the spread of COVID-19, of course, but masks are used in many other ways. And so we wouldn't want somebody who's sick with another illness where they would need to wear a mask, something like tuberculosis, where masks are very much an important part of what we work with people around in those first days and weeks after they're diagnosed and found to be infectious. So um, the real issue we're trying to prevent here is spread of COVID-19. There is some chance that, as we just talked about, people could be handling them and increase the chance of contamination. But that's where we think on balance, people are really pretty good about this. They've figured it out. They've been doing it for a while. They've got lots of stores and organizations that are already requiring them. And so we're really coming a long way, and we're seeing in other jurisdictions they've been an effective part of this. There is some chance as well that with wearing masks, you could get some irritation of your face or those sorts of things that are not infectious. But in those cases, that is where, be talking to their own medical practitioner about what to do and what the best circumstance was, and whether, for those individuals, mask wearing is something that they
I
could
just
do.
want to say, I heard that the mask must be kept dry. And with this humidity outside, if I would bring a mask with me, I leave it in the car because I want to have it there. And then I put it on and it's all wet. And I go into a store. What happens then? Would I be spreading more my germs? Just want to be clear.
So just in terms of the current humidity that we're experiencing, when we're talking about masks, absolutely, they're going to get some droplets on them from our speaking within them. And so that's not the kind of level of dampness that we're talking about. But ultimately it is. You don't want to be wearing a mask and it's staying damp for day after day. And so they are recommended to be washed on a regular basis when you're using them. I don't think that anybody who's actually feeling like that mask is wet, that's when that's not the time to be using that mask. That's the time to go find something else that you can use to do that and go in. So the challenge is, of course, that you do decrease the integrity of that mask if it is wet, particularly with the disposable ones. But if you're in that situation, really you need to find an alternative.
Councillor Pauls.
I have a couple of more questions because I have a wonderful email from a lady that really raises a lot of questions. That is, when you go to the dentist, and I did, they don't want me to bring my mask. They give me a mask because they say they don't know where my mask has been, or if I've been careful to wash it, or to make sure my mask is clean. So I don't want to bring my germs into an enclosed area. So they give me a mask, I put it on, then they take it off the mask because it's important to take the mask off properly. I did my walk and I saw all kinds of masks on the ground, honestly. 3 days ago, I counted 40 of them. And I'm wondering what this bylaw is not for the people that want to wear it or the people that don't want to wear it. It's the people that don't care. They just have a mask just in case because it's the law. And they wear it everywhere. They don't wash it. That is my issue. And my issue is also that I heard you say that if you go to a restaurant, when it's open to go in, you get the mask, then you take it off, then you eat, then you put it back on. If you don't do it properly, you're literally carrying the germs with you and going different places. And that's what I'm concerned.
Okay.
Also,
Okay.
you
Well,
said
let her deal.
that
Let
it
her deal with that
doesn't
question, and
be a
then I'll come
mask.
back with the other one. Go ahead.
Right. All right.
Through you,
Yes.
through you, Mr. Mayor. I think the question, if I'm understanding you correctly, Councillor Pauls, is about, you know, the fact that it is important to use them and utilize them correctly. And you're absolutely right. And that was the concern from early on. And that's why we've been talking about it, and continuing to educate around them is going to be important. We know from all sorts of different things that when people know and they understand why it's used, that by and large, you know, people do it correctly, and they're quite willing to do that. Is it imperfect, as are many, many things? Absolutely, it's imperfect. And there are, if not done correctly, it does come with its challenges. But I would have every confidence that, you know, especially given what we've seen from other places in the world, that people will do so as well as they can. That where there are challenges, people will be seeking out how they could do so better. If they don't understand, there'll be lots of opportunities, you know, for people to do that. And of course, if anybody has any questions, they can always call us, and we can help them with that too. We'll have educational materials, as we do already, up on our
Okay,
website
thank you.
around
You're
it.
also past the 5
I
minutes
just
at
have
this
one
point,
more
so
question, and then, you know,
okay.
I'm a grandmother, and I know children. And if we pass this law and it would go into October, November, and they go to school, can you tell me what a 6-year-old, a 7-year-old, and I would put a mask and not touch it and not spread the germs more? How do we deal with that?
We're not regulating schools at this point, so that's kind
Not
of
the
not
school.
that's exempted. Yeah.
The schools are exempted? They
Yes.
don't have to wear masks?
No, they're exempted because we don't have any authority on what they do in the school. So the school board's going to have to work on that issue.
Right. I really, I wanted to ask a few more questions. I might go back on
Okay.
on the top. Okay, thank
Okay.
you.
Thank you. Councillor Johnson.
Yep, thank you. Thank you very much. Before I go into a comment, I just wanted to ask Dr. Richardson, and thank you so much, ma'am, for everything you and your wonderful team have done. You have my utmost respect for everything. You've been throwing a lot of curveballs, and you're hitting it out of the park every time. Good for you. On page 3 of 12, I know we touched a little bit about the enforcement. It does say in the middle of the page that it does not recommend any additional staff. I believe at the GIC I was begging the staff to put the yellow tape back on because our bylaw department, Monica, is completely overtaxed now as it is, with not only our own bylaws that we have on the books, but all the new stuff that's been coming down from the province and all the stuff that's been coming out of our emergency operations center. So how are we able to enforce this motion if it goes forward? And I mean that with all the most respect, because I'm seeing lots of other municipalities are having that same question. And in fact, somebody, Niagara actually deferred their decision because the bylaw enforcement could not be addressed.
Through you, Mr. Mayor, if I may, I'll probably start off. And then, of course, you know, the enforcement and staffing really belongs more properly with Monica, whose crew is going to be primarily responsible for it. But first, Councillor Johnson, thank you so much for your comments. I really sincerely appreciate that, and it makes such a difference to hear those things for myself and for all of my staff, because we've all been working very, very hard and trying to do our very best. So thank you. In terms of the enforcement piece, you know, I come back to the objective here, which is to get mask wearing levels up over 80%. And, you know, our experience has been with many of the bylaws that have been put in place where we are trying to really get across the message about how important this is, where we're trying to talk about the roles this can have in the health and safety of our population, that we do experience very high levels of compliance with them in general. We found that with smoking in parks, for example, where we've been enforcing on a complaints basis. Absolutely, we need to do the education that goes along with it. And we've been doing a lot of education about masks for some time now. And so we know people are aware. We have many businesses that have already made the decisions to go with this to operate themselves. And so the public is getting more and more accustomed to this issue. And so we really are thinking that, while in the usual course to business, yes, our public health inspectors will see some of this as they go out to restaurants and out to other places. And, Hamilton Police Services may as well in the course of their business. But the complaints-based investigation will fall to our MLE colleagues as they go forward. So I'll turn it over to Monica.
Is ready.
And Monica,
Ahead, Monica.
excuse me, before you start, Monica, thank you so much for everything. I can tell you right now, people who are working from home are now starting to notice what their neighbors are doing. So we're getting a lot more influx of calls about why is he building this shed? So, and et cetera. So you guys are taxed to the max. I know this. So can you please explain to me how you can do this?
Yeah, absolutely. Through the chair and Councillor Johnson, I really appreciate your comments, and I know the entire team does as well. If council does pass this bylaw today, and if it is deemed to be a priority, I will be completely frank, other bylaws are going to have to take a backseat.
Right.
We are stretched as thin as we can be, and we are already enforcing, as you mentioned, a lot of the different provincial requirements that have come down the pipeline, and those have remained to be our priority. And as a result, other bylaws, they will take a backseat, they will be slower to getting to, or they're going to be paused completely.
Thank you for that. And Mr. Mayor, I just want to make a comment. I can tell you right now that I have a very close relative that works in a Hamilton mall that's just recently opened. The mall is supposed to be monitoring the amount of shoppers that come in and also police all the social distancing. And I can tell you from anecdotal conversations that this is not happening. One of the, as you can see, most of the malls have very tiny stores. So a lot of the stores have been very, very diligent of keeping someone at the doorway to say, do you need a mask? You need to wear one, and limit how many shoppers are coming in. I can tell you that my close relative has been yelled in her face to the point of spitting. So the reason that I want to endorse this is that if we can give those employees, the essential workers on the front line, some added protection and added enforcement, so that now that employee can stand there and say, it is a Hamilton bylaw. I'm not doing this to be in your face, but this is now a Hamilton bylaw, and it gives them some backbone, then I'm all for this. We need to keep these folks safe, folks. They're the ones that are meeting hundreds of people every single day, and we need to make them and keep them healthy. So maybe the new signs will say no shirts, no shoes, no mask, then no service. So thank you very much, everyone. I'm supportive of this going forward.
Thank you. Councillor Wilson.
Thank you, Mr. Mayor. Thank you, Dr. Richardson. Just for the public's sake, on page 10 of the report, I don't know if maybe I am asking you to speak to it. You reference that your department is working with community support agencies to increase the accessibility of masks. That's sort of apropos our earlier discussion today about health equity. I didn't know whether you wish to elaborate, because I'm sure we will have questions about access and equity.
Through you, Mr. Mayor, this issue of access to masks is one of the issues that we were considering while we were putting this together, and we've reached out to other organizations. We know some of them are already doing this in the course of their own business in terms of helping individuals out. We've reached out as well to the United Way. We know in the eastern part of the province, they've had a very successful campaign in terms of helping to support both business in having masks, but also then using funds that come from that to help support individuals in it. So we'll continue to work with various agencies to look at how we can increase supply to masks. I don't have a fulsome piece on that for you yet today, so but it is something we're continuing to work on.
Mm-hmm. Thank you. You've identified it, so that's a great start. And in terms of, we said no to masks earlier, or at least the federal government did, and now we're saying yes to masks. And I guess that is that's the beauty and always the challenge with health, that once we garner more evidence of the impact of this beast. We become better informed as we go along, and we need to pivot. That's what health research is all about. That's what we need to do. So now that we know that there's emerging evidence showing us that wearing cloth masks in indoor spaces is necessary, we have to act necessarily. So I think one of my colleagues quoted somebody earlier, I can't recall who it is, and I'd like to take the opportunity to quote Maya Angelou: do the best you can until you know better, and then when you know better, do better. So public health is good for the economy. It's good for local property taxpayers to put the investment in early. And I think reference has been made to what's going on in the United States. There can be no greater evidence of what happens when you do not do that. So thank you very much. I too appreciate the efforts of yourself and your team.
Thank you. It's myself up next, actually. So you know what, we've had a flurry of emails, some of them, many of them form emails, indicating that we're restricting the right of people to worship. And you know, I take exception to that. I mean, clearly, the irony is that one of the biggest challenges that we've had is in congregate settings. And by definition, you know, a church is a congregate setting. And so the opportunity to spread a virus in that kind of environment without minimizing protection is very, very high. And so is this bylaw in any way, shape, or form prevent anyone? I mean, right now it's limited to 10. I assume that phase 3, when we get to it, will open it up even further. What we're saying here is that opening it up further should mean that more people need to protect themselves more. Is there anything that we're doing here today that prevents a church from having 10 people come in to worship or to sing or to do any of the things they'd like to do in a church?
Through you, Deputy Mayor, to the Mayor. It was an interesting one to read because I wasn't sure I didn't understand why it might be interpreted that way. So, but in this particular instance, when it comes to places of worship, the province has been the one writing direction about what are the restrictions that are there and what should be followed. And as you said, as they reopen, there are changes there that are being made that affect places of worship, and they're gradually reopening along with the rest of us. In terms of this specific bylaw, it does require masking in a place of worship, but it doesn't in any other way restrict attendance at it. And indeed, I would suggest as well, just as we're talking about restaurants or other places where if you need to remove the mask to receive a service, that would be acceptable. So for somebody who was to, for example, in my faith tradition, we receive communion. If somebody was to be receiving communion, that would be an acceptable reason to remove your mask as well. So I don't see any hindrance to worship that we have. But of course, if there was other information people had, we'd be more than welcome to
Okay,
hear it.
thank you. I mean, that's an important issue, which you know, many of the negative emails that I've received have all been focused on that issue, which surprised me. Again, congregate settings are where we've had most of the challenges. Congregate settings in long-term care facilities and places where people find it difficult to physically distance. It becomes a huge, huge problem, and we don't ever want to get into that space. You know, and then just as a comment, you know, I fully support this. I have heard from many businesses in our community, not unlike Councillor Johnson's notion that there's such a mishmash of policy out there, and we thought the province could help us all by having a reasonably consistent, at least in higher density cities. They've declined to do that. That doesn't mean they're not recommending masking. They just don't want to be the one doing the policy, and they've left it up to local municipalities to sort that issue out, which is unfortunate. But here we are, and I think we are obliged to put into place the levels of protection that allows a business owner to point to a sign and say, "I'm not the one that's forcing you to requiring you to wear the mask. It's a bylaw of the city of Hamilton." Take that argument off the table. I can also tell you, and you know, some of the business owners that I'm aware of, that one test in their establishment, if someone needs to get a test, could literally, especially for small businesses, shut them down, because everyone has to then go self-isolate, and everyone has to take the necessary precautions. And I've also heard from many businesses in our community that if we ever have another shutdown the way we did, you know, back in March, that their businesses are done. They cannot survive a second round of shutdown. And so, for all of those reasons, I think minimizing risk is just a smart thing to do for anyone. Now, having said that, when you look at countries that have been practicing mask wearing for quite some time, especially during the influenza time, they've fared way better in terms of influenza and other issues of transmittable diseases as a result of the mask wearing that they've done. And so this is not a foreign thing to have this happen in our community. Certainly different, but a wise choice for those that do care about their fellow citizens and do care about ensuring that the spread of this disease is minimized. And there was a time in areas of the United States like Florida where they had minimal cases. And all of a sudden, because of travel, because of all kinds of things that had started to open up, including massive beach parties and all kinds of things that got out of hand, they're now the highest caseload in the country, if not almost the highest caseload, if not the highest caseload. So this thing can turn in a hurry. And for us to put measures in place to stop that from happening, I think is critically important. So I fully support this. I think this, the infringement on rights, that went out the door a long time ago. Someone's mentioned seatbelts and, what you're required to do on an airplane, what you're required to do before you even get on an airplane. You got to virtually, take everything off that other than your pants and your shirt. And everybody has adhered to that. Why? Because they understand that the hazard of someone bringing an explosive or some sort of apparatus onto an airplane can impact everybody that gets on the airplane. And so, for the good of all, we go through that process to ensure that we don't allow anyone to bring some sort of a substance onto an airplane that could kill everybody or take the plane down. That those issues have been around, and they're there for protection of the public at large. And so this is no different. And for those that are objecting, especially the church folks, please congregate. Physically separate, follow the rules, and if your church is open at this point, to having people come in at physically separated basis with less than 10 people, there's nothing here that stops you from doing that. I remember early on, in this whole process, we had requests from some denominations to have parking lots opened up for church congregations. And then, that went silent when people realized, how much damage was being done in the United States when they were actually practicing that sort of thing. And in fact, some of the pastors that were advocating for, don't worry about it, everything will be all right, ended up being victims of COVID, and many of them actually passed away as a result. And so I am intrigued by that notion that somehow we're restricting their ability to worship. I don't think that's true at all, but we are restricting their ability to spread disease to other people in their congregation and beyond. And I think that is, for those that care about their community and others in it, is a sensible and responsible thing to do. So I fully support it, and I thank the good doctor for bringing forward. And you know what? Suggest, because this has not happened to date, and it's not happening now, that this is being politicized. Not even close. This has been an evolving issue. Early on, it was all about protecting the frontline healthcare workers because we knew that the supply of personal protective equipment was limited, and if they didn't have those protections, we would have lost many, many healthcare workers. In fact, many healthcare workers were probably refused to show up, which was a really, really big concern earlier on in this pandemic. That has lightened, and the supply has increased. And we're not talking about taking personal protective equipment away from frontline healthcare workers anymore. In this particular instance, it's a face covering. We're not talking about an N95 mask. We're not talking about, the kind of shields and masks that they're using in the healthcare workers. And God bless the healthcare workers, because they operate in that environment with all of that equipment on, 12 hours a day, 6 or 7 days a week. It's absolutely astounding to me how they do that, but they do. For all the right reasons, not only for their protection, but for the protection of others that come into the hospital. And so I think we're on the right path here. Sure, there's always going to be detractors. Many of the emails that I got also weighed into this whole COVID thing has been a hoax perpetrated on the citizens of the city to prevent them from having liberties and taking civil liberties away from them. Well, that's not the case either. There's no hoax here. There's no attempt here to disadvantage people. There's every attempt here to protect people, and that's really where we should be focused on. So thank you, and I'm going to turn it over to Dr. Vanderbeek. Yes, Dr. Vanderbeek, would you please?
Well,
You just got a status elevation. You may or may not want that. Yeah.
Friday elevation.
Yeah.
Great.
Councillor Vanderbeek, go ahead.
Thank you. Thank you very much, Mr. Mayor. I am not going to take very long. I really just want to say that I appreciate the report from our medical officer of health. I am going to take her advice. We do not have a vaccine now, and there isn't one on the horizon anytime really soon. And so for me, I'll be wearing my mask to protect other people, and I truly hope that other people will wear their mask to protect me. I'll be supporting this. Thanks.
Thank you. That was Chris. Thank you. Councillor Nett. No, not on right now. Okay. All right. Second time speakers list, and we can put Councillor Nett on. Are you there?
Yes.
Oh, okay.
I apologize. Sorry, I turned off my video so that I could have some lunch and didn't realize it wasn't back on when I finished.
Okay.
Thank you through the mayor. All the questions. I think there's one question remaining for me from those that my colleagues have asked, and that's in relation to the portion of the bylaw or in the report that refers to reasonable accommodation. And the reason I bring it up is because I have had a resident reach out to my office who wanted to inquire about a pretty interesting and unfortunate scenario for her in terms of her grounds for reasonable accommodation. She's a victim or survivor, actually, of partner violence that involved physical choking. And for her, she's tried many times to put on a mask and do the responsible thing, but unfortunately, it's just far too triggering for her to put on a mask and go out into the community. So she's chosen with her family to be the one that stays home, and her partner and her children go out to take care of the things that need to be taken care of outside of the home. Would that be considered a qualifiable, reasonable accommodation? And what does she do with this bylaw once it's enacted?
Thank you. Doctor?
Through you, Mr. Mayor, there's certainly going to be individuals for whom mask wearing or face coverings are triggering, and they may have other reasons behind them. It's probably best for me to turn that answer over to Monica to answer about how MLE would handle it, and if there were a complaint made, which is the basis on which we would move forward with that. But certainly within the bylaw itself, what we're saying is that if people state they cannot wear them for a reasonable reason, then that would be taken at face value. But over to Monica.
Through the chair, I guess it would be echoing exactly what Dr. Richardson has said. We would be taking it at face value. If a complaint did come in, we would use our officer would use the discretion to go in and investigate, but by no means are we asking for personal information or personal health information or anything to that. If they say that an exemption applies to them, we take that at face value. To go further into your reasonable accommodation, I'm not sure if that answers it completely and if that requires more of a legal breakdown, but from an enforcement perspective, that's how
I appreciate it, Monica. You did answer it. It was more about from an enforcement perspective. And similar to the rest of my colleagues, thank you, absolutely big wholehearted thank you, and constantly to our public health staff and Dr. Richardson for your entire team for the work that you've done to help maintain public health and a sense of security for our residents while we all contend with the COVID pandemic. The only way we can truly move forward towards reopening and economic recovery is if we uphold public health first and foremost. Without ensuring that we are taking every step possible to keep our residents safe, businesses cannot open their doors. And if our businesses are willing to open their doors, then they know that they need to take some steps to help ensure not only the protection of their workers, but also the protection of our public that are their customer base. I can also acknowledge that it's going to be a difficult transition for some. And perhaps these are the folks that haven't been used to wearing masks or haven't been choosing to wear masks over the time and duration that we've all been experiencing this pandemic. I have to say that I took on some early education with my 4-year-old, who could probably record a pretty fun video PSA if we needed to on how to put on and take off a mask, and the few times that I've had to take her with me to do some grocery shopping when my partner was working. So, folks, I think for those who are complaining and those who feel like it is just too difficult of a transition, honestly, if you give it a go, try it every time you go out the door, you'll realize it's a pretty quick flex to be able to get into a regular rhythm around. And honestly, the work that all of our residents have been doing over the course of these months in practicing COVID compassion by wearing masks, by washing their hands, by maintaining that safe physical distance. It has made the biggest impact and has been the reason that we've been able to flatten the curve. And perhaps some people are feeling some compassion fatigue. But fundamentally, at the end of the day, this is evidence-based, this is scientific, this is about promoting the health and security of our people and keeping the transmission down. So I'll be absolutely in favor of the report that's before us in the bylaw. Thank you.
Great, thank you. So a list of second-time speakers at this point is Councillors Ferguson, Jackson, Clark, Pauls, and Pearson.
Yeah,
Councillor
thank you,
Ferguson.
Mr. Mayor. And I see we got some good news here where the water ban has been lifted. So at least we something positive happening today. My two questions have been answered. One was about stage 3 with restaurants and the other about enforcement. So just some brief comments. I'm concerned that 90 days is a long time in the pandemic world. We've only been in this for 120 days, and this is going to take it out another 90. And a lot can happen, as we've learned over the last 4 months, over a 90-day period. And I've said it before, and I'm going to keep saying this. I sense there's a large segment of the population that are scaring the daylights out of, and I'm not sure we're ever going to get them to come back out. I know a lot of people that haven't left their home yet because they're too frightened. All 3 levels of government are always putting out bad news and scary news. And, leaders are supposed to spread hope, not fear. And I, other than the numbers we've been seeing over the last few days, which is good news, I heard nothing but fear today. And I'm just concerned that we're going to have real trouble getting the population back out and enjoy themselves and get the economy going after this is all over. So those are my comments. 90 days seems like a long time, and but I do see the caveat there where council can change that if they want to, but it's not going to be reviewed for another 90 days unless council asks for that. So that's all my comments.
Okay,
thank you.
Thank you. Councillor Jackson?
Thanks, Mr. Mayor. Am I on?
Yes, you are.
Thank you, sir. Dr. Richardson, just to be crystal clear, if approved, this mask wearing is for indoor spaces only, correct? Through you, Mr. Mayor?
Through you, Mr. Mayor, absolutely. It applies to specific indoor public places. In fact, they're that are outlined in the bylaw.
On the B part, I want to piggyback on Councillor Ferguson's suggestion. On the B part, the way it's worded, be reviewed by Board of Health in 3 months. Dr. Richardson, you chose 3 months because you thought that was a fair amount of time. I would have preferred to see 2 months. That would take us to September 20th, but there's an absolute commitment in B that you will be reporting back with an information update to Board of Health through you, Mr. Mayor.
Through you, Mr. Mayor, that's correct. We would come back with an information update.
And you felt the 3 months was a commensurable amount of time. Like I said, I'm similar to Councillor Ferguson. I would have preferred a little shorter period of time. Now that we have a bylaw that will be educating firstly, enforcing if necessary secondly, I would have preferred 2 months, but you chose 3 because, through you, Mr. Mayor?
Through you, Mr. Mayor, just looking at the time frame that we're talking about in the season that we're going into, of course, respiratory virus season. And so to really get that review done and bring it to you earlier in September wouldn't really take us into that next part of the year and take us through the experience of reopening more fully here in Ontario, which is part of what we would want to see and see what our experience is. And so we've looked at what other jurisdictions have done in terms of how long, and we felt bringing it back after 3 months would make sense. Bring it back around the time of Thanksgiving.
Oh, okay, thank you for that explanation. I'm fine with that with the formal report back in 3 months. Lastly, my comment, Mr. Mayor, I'm going to be supporting this, but Dr. Richardson, Dr. Harvey, Dr. Tran, to you and your staff, please be prepared. I am very loath to some of the insinuations out there for those that will be against mask wearing, Mr. Mayor. that this is some form of a control freak by me as a politician, some form of draconian extra measure, totally unnecessary. Dr. Richardson, I say very respectfully and sincerely, I'm accepting this as your strong recommendation from your public health team. And so my staff and I, although I will defend every and all vote I do at this table, ultimately, I will say that it was based on the recommendation of our public health team, and I will have my staff be referring anyone who has objection or still is unhappy over the bylaw. I will be referring them to your office so that your office can confirm and explain why you recommended this bylaw. Thanks very much, Mr. Mayor.
Okay, thank you. And so that 71 staffing count that we talked about earlier has to be bumped up by another 10. No, I'm just kidding. Thank you. Councillor Clark.
Thank you, Mr. Mayor. I have one question for Dr. Richardson. It's really short and hopefully a short answer. And then I have comments. The question is, can I contract or get infected with COVID-19 and have no symptoms and spread the disease throughout that period of time, the average of 14 days, to other individuals, not knowing that I have the infection? Is that physically possible?
Doctor?
Okay, through you, Mr. Mayor, I'm going to try and keep it very short. Councillor Clark, the answer is yes, but thank you so much for raising that, because that is exactly the challenge, and why not waiting until you're symptomatic is so important about this mask wearing bylaw. We think the majority of the spread happens before people become symptomatic. So we call that the pre-symptomatic phase, or amongst people who are entirely asymptomatic. And so just, having people who are sick wear them or stay home is not sufficient, but having mask wearing by all, because you won't know it until a few days later that you've got it.
Thank you. And the answer to that question is very important in terms of my response to how I'm going to vote on this. So I'm fully supportive of what the doctor is recommending. I have an analogy, I guess. Years ago, I had to visit some people when I was with the Knights of Columbus, cancer, leukemia specifically. And so they were undergoing bone marrow transfusion, I guess is the terminology. And when I went to visit them, I was asked to wear a mask. And I inquired why. And it was to protect the patient in the bed, because they don't know what viruses or bacteria that I was carrying. I could have had a cold, I could have had anything, and anything like that to someone who has a chronic immunocompressed disease, and when they're being treated, the risk of infection is high. What I took from that, and in the discussions with the nurses back then, was that this simple rudimentary task of asking visitors to wear masks and gowns to come in to visit someone who could contract a disease unknowingly worked. It prevented the transmission of the disease, really high numbers, 90, 95% of the time. That's consistent with all of the studies that I read from the CDC, the Lancet, and the Mayo Clinic. So I take from that if we ask our residents to wear masks when they're out into an indoor setting, they're really protecting everyone else from anything that they may have. And given the question that I just asked Dr. Richardson, can I spread it without symptoms? And the answer is yes. Then for all those people who are complaining that this is against their rights, are they really willing to risk someone else getting sick because they're unwilling to wear a mask for 15, 20 minutes while they go into a grocery store? That's what it's coming down to. And I loathe the fact that we have to do a bylaw. In my mind, it could have easily have been a medical officer health order. But the fact of the matter is, what we're talking about, the strategy has been proven to work. So if we're wanting to stay ahead of this, if we're wanting to prevent the next lockdown because of what's happening in America, where they're now starting to talk about locking down states again, which would, as the mayor said, crush many local businesses. They would not come back if we lock down again. Then the logical way of doing it is to mitigate the risk, which is the mask. And so I fully support this. I think it makes complete sense. With regards to the churches, I did note that on June 12th, they're allowing the churches 30% capacity now. So the province has allowed 30% capacity in the churches. So all these emails that we're getting that we're somehow preventing people from going to church is not even close to being accurate. And I really believe it's time for the residents to step up and say, listen, we're going to protect each other. And if we do that, we will make sure that the curve stays flattened. If we don't do that, I fear the second wave could be catastrophic. And that won't start until the fall, hopefully. But we want to get ahead of it. So I commend Dr. Richardson and their staff for a comprehensive bylaw. I really hope it works. And I really hope the folks who are pushing back because they feel it's unconstitutional recognize that their constitutional rights are not absolute, that there's numerous laws that have been passed that one would argue are constitutionally flawed, helmet laws, seatbelt laws, and they've been no smoking in public places. All of them were argued at one time as unconstitutional, and all of them were deemed not to be unconstitutional. So at the end of the day, we're protecting the public health and safety of our residents. And we're not the only municipality that's doing it. Since the province is unwilling to do it, almost every municipality in the GTA is doing it, and I think we should be one of them. So I support this 100%. Thank you.
Thank you very much. Councillor Pauls.
Thank you. Dr. Richardson, if I'm unaware that I have COVID-19 and I quickly put a scarf over my mouth and I walk around, because you could also wear scarves, I heard, or bandanas, and I don't do it properly, would I spread the disease? Mayor, that's a question someone asked me. So, Dr. Richardson?
Through you, Mr. Mayor. So the use of the face covering is to reduce the likelihood of spreading the disease. So even with wearing it, you could still, when you look at many people, it still could happen. What we're trying to do is reduce that chance. So ideally, you're wearing it properly. You're wearing something that has 2 good layers of cloth, or a disposable mask of some sort, and you're going to not touch it. You're not going to do anything, and do it ideally, but nothing is a guarantee.
Exactly.
And if you have a communicable disease, you could spread that communicable disease. And we're trying to do everything we can to prevent that spread.
So, Dr. Richard, can you give me your assurance that an improper mask wearer or unclean mask does not spread the COVID-19, or does it do more harm by wearing it? I want to be assured that wearing the mask, I'm properly, I'm clean, because I know there's people that don't wash their masks or their scarves, that maybe not because maybe they don't want to, they're lazy maybe, or they don't think they need to. There's many reasons why they don't do it properly. So can you assure me that that does not spread the COVID-19 or other harmful diseases?
Doctor?
Through you, Mr. Mayor, I think, whenever we're talking about something like this with infectious diseases and control measures, we need to look at the evidence as a whole and say, as the population as a whole does this, does it help or does it make things worse? What we've seen around the world is that it helps, that the evidence shows that this is beneficial. It does not guarantee us that somebody will make an egregious error and make things worse. There's just no way that kind of guarantee can be made. But what we can say is we'll do our very best, and we know that people in our community will do their very best to do this well. And where there's concerns and there's more education needed, we'll provide it. When there's concerns and people, really are doing something that's a problem, then Monica and her staff are going to address those situations. And that's the very best that we can do as a community.
Thank you.
I don't know I don't know who to ask this. Did we legislate the hand washing and the 2 meters? Did we legislate? Do we say now everybody has to wash their hands, so we have to legislate that? Did we do that? Who do I ask?
Dr.
I know what the answer is, but
we did legislate physical distancing. We put a bylaw in place, and there were fines associated with that. That was absolutely done at council.
right. And hand washing, which is
hang on. I heard it, Councillor, Doctor.
So through you, Mr. Mayor, one might ask, why not legislate each and every one of these particular measures and decide to do that? And indeed, as the mayor, sorry, Mr. Mayor, as the mayor just stated, that was a choice that this council made earlier around the physical distancing bylaw to make sure that that was happening. As what we're doing always is taking the evidence, what other jurisdictions, what the science has found to be helpful in moving things forward. And when it comes to masks, this is a piece that's helpful. Are people doing hand washing? Are they, using the sanitizer where they're not in a circumstance where they could use hand washing? Absolutely, we would want them to do that. But ultimately, we have to go forward with what we think is going to make the best difference without being overly intrusive. And this is one of those situations and why we're recommending
I find that information is always evolving about COVID. So we're sort of changing our mind as we go along. But I always think education instead of legislate is always better. I think people might educate themselves some more, and they want to do their best because this is serious. So I always thought education is better. So I'll have to think about my vote, but I certainly want to make sure people know that I do care and I do believe COVID is here and I do believe we need to do things. But I also want to hear the other 50% that says, I'm doing my work, I'm doing my job, I'm washing my hands, I'm making sure I don't have people over, I'm following every rule there is. And now that the curve is flat, you're going to give me another rule. And so I don't really know how to answer that in a way. Am I giving you another rule to follow? But this time I'm going to legislate it. So a hard topic for me. So, but I want everyone to know that I do care and I do appreciate your, advice and your report. And I do try to follow, what the medical does because I'm not a doctor, but I really
All
have to
right,
think
thank
about
you.
this
That
one.
was
Thank you.
5 minutes and beyond. Councillor Pearson.
Thank you, Mr. Mayor and Dr. Richards again. Just a couple, and it's interesting because as we're discussing, I'm getting emails as well asking questions. So first off, Dr. Richardson, I know in the bylaw it mentions that if you are engaged in any athletic or physical fitness activity, you do not have to wear a mask. But I'm being asked, so I have an establishment, and then I'm going to ask Monica because I don't think they can be open yet. I believe it's the Cicada entertainment organization where they do Cirque du Soleil sort of. So they have gymnastics, dance, music, and singing. I'm going to assume that would be separated so they can do the music, they could do the gymnastics and the dance without masks, but would they be required to be wearing masks when they have the music and the singing?
Doctor?
Mr. Mayor, I'm going to turn these ones over to Nin and Monica.
Okay.
Okay. Monica.
I'm going to have Nin take the lead on sort of the definition of separating out whether we're singing or dancing. Okay. But just to answer your question about whether they can be open, specific establishments can be open if they're training for amateur sports. So if there's any sort of amateur sport or dealing with something that's designated under the Ministry of the Heritage, then they are permitted to be open. But other than that, I'm going to flip this over to
Thank you.
With physical distancing, right?
Correct.
Yes, that's right. Thank you.
Yeah. So through you, Mr. Mayor,
You're not going to pass the buck? Put it on down to somebody
situations,
else here. There's a list. I'm just kidding. Go ahead.
Yeah, so we haven't looked at specific categories within that, but the intent is if you're swimming, you're doing doing significant amount of physical exertions in a gym, that type of thing, where it's impractical or it's impeding your ability to actually do that physical activity. That was the intent, and we'd have to certainly look in terms of what that operationally what does it mean. But I think we take some sort of feedback, but that's something we can explore a bit further. But it would
okay. I will follow.
yeah. take things count in terms of your swimming, your
Exactly. Yeah. Well, you can't wet the mask, but yes. So I appreciate that. I'll certainly follow up with them further, and if there's anything additional, I'll forward it to staff. Actually, a good question was raised, or a good point was raised by Councillor Jackson. I want to touch on it. That was the questions that will come from residents, continue to come from residents now, why we're doing this. And I know, Mr. Mayor, you raised a comment that, now we're going to have to hire more staff just to address the answers to these
Being
questions.
facetious,
I know, but I'm just wondering, in the interest of simplifying this, could Dr. Richardson formulate a snapshot of an answer that could be sent to us that we can cut and paste and send to residents to say, this is our Board of Health, Dr. Richardson's position. This is why this is moving forward. And that would help everybody, that we all have it at our fingertips. Would that be something I could ask, maybe direction, Dr. Richardson, you could follow up with?
Through you, Mr. Mayor, absolutely. We can do that for you.
Super, thank you. And in closing, I didn't say it earlier, and I think Dr. Richardson did way back at the beginning of our conversations. I respect residents, and I wear a mask because I respect you, and I ask that, out of respect, please respect me and wear a mask as well. So thank you.
Okay, thank you very much. Councillor Wilson is the
Thank you,
last
Mr. Mayor.
speaker on this that I have
Yep,
at this point.
yep,
Thank you.
yep.
Go ahead.
Thanks. Further, I think just along the lines that where Councillor Pearson was going on a communication plan on this, I was asked, I believe I received a call about the city's water ban. It was like a robocall. Will we be, we'll have a communication plan for this, I'm assuming, and would it include any kind of a robocall to that effect? Thank you.
So that's not for the doctor to answer, unfortunately.
I assume it's Mr. Grant.
I don't think we wouldn't be doing a robocall. So I'm not sure what that robocall is talking about, but we are going to communicate.
I received a call notifying me as a resident that there was a water ban on, and I know a number of my neighbors did, and they appreciated it because unfortunately we have a shrinking newspaper circulation. Not everyone is on social media. So my question stands.
Okay, is there someone on the call that can answer that question?
I'd have to look into, through you, Mr. Mayor, I'd have to look into it further. My understanding is we're not planning a robocall. And from my understanding of when we usually use robocalls for something like water bans or drinking water advisories, that type of thing, they tend to be where there's time sensitive and time limited action that needs to be in place rather than a general public messaging of something. But I know that our communications officer support for the city is developing a communication strategy for the public as well as businesses and other establishments to support their understanding of the bylaw, as well as what Monica is going to do in terms of education as well.
Okay. Councillor Wilson.
Thank you.
Councillor Marula, on this?
Yes, just on this issue and for clarification purposes, back in the mid 2000s, when we offered the subsidy for the backflow preventers, so particularly it was meant for the lower city that was experiencing basement flooding. Everyone's phone number was registered because when you put the backflow preventer in, it needs to be maintained. So they have a robocall system that they established, and now they use that robocall system to alert them of any type of flood, potential rainfall that might create a flood, and or any other public works scenario. So this is not the appropriate forum, but it's a good point and a valid point that Councillor Wilson brought up that should be directed to Public Works. So just for your clarification.
Okay, good, thank you. And we will be communicating on the lifting of the ban, and promptly, I'm sure there will be happiness throughout the city as a result of that. So we're on this item, which is the face covering and enclosed public spaces. It was moved and seconded earlier on. I don't remember whom. Remind me. Pearson and Nan moved and seconded the direction. We'll go to a vote at this point, and those in favor and those opposed. She's just deactivating the speakers list, and the vote should be there shortly. And that is carried 13 to 2. Thank you. Thank you. Are there any issues regarding the amendment to the outstanding business list? There's some amendments in terms of dates and timelines. They're all before you. If you don't have any questions, can I have a mover and a seconder on approving that? Moved by Partridge, seconded by Vanderbeek. Or is there a question? Those for move and seconding. Thank you. Any comments or questions? Going once, going twice. Okay, let's go to a vote to approve the outstanding business list. Sorry, we're good? Okay. Councillor Farr, are you still there? I don't see him on the screen. And that's carried 14 to 1. And I know Councillor Wilson, under other business, that you had something you wanted to raise a point of privilege, I believe. Councillor Wilson?
Me. It was earlier in today's meeting on item 10.1. It was insinuated that I was unaware of the conflict of interest guidelines, which we must operate under. And therefore, it was insinuated that I may have been in a conflict. It's important for me and my name and for the constituents of Ward 1 to fully understand that I was not in a conflict of interest. I am fully aware of those guidelines. I do my best to operate and abide by them. And I would suggest, if it was a point of courtesy, that a message could have been sent to me privately, and I could have clarified what the rules are for the member. And this has never been raised for anyone else, so I appreciate that. It didn't need to be raised for me. Thank you.
Okay, thank you. And it's always a personal choice. No one can give you advice one way or the other in terms of whether you should or you shouldn't.
Thank you.
That is totally your call in every instance. So thank you for that. I have no further speakers on any issue. Can I have a motion to adjourn? Moved by Pearson, seconded by everybody in the room. Curtin Collins, all in favor. Going to fire up that electronic vote because they want to get out there and roast like the rest of the population. Thank you very much. Stay cool out there and check in on your neighbors that may not have air conditioning. They'll be struggling most. And you know, in terms of the doctor, while I have you here, remind us where the cooling centers are. Unless you've left already.
No, I haven't left already, but I have got that list at the tip of my fingers. I'm wondering if Paul does.
Paul, do you
Or
recall
Michelle.
the cooling centers? Just so people will know, because it's we're at the peak.
No, I'd have to look them up because I'm sure I'll miss one of them.
You know, I'll mention it in the media advisory a little later on, just to remind everybody that there is a place that people can go to cool off. It's very, very important. I can't imagine the heat in an apartment that doesn't have air conditioning right now, especially if you're elderly. It's got to be a particularly bad struggle. So thank you all very much. Have a great day. Have a great weekend, and we'll see you soon-ish.